Good afternoon. I'm State Representative Jonathan Steinberg from the 136th District, Westport, Connecticut, co-chair of the Public Health Committee. Excited to be here with the Public Health Committee for another day of JFing bills. We have a good number on the agenda. We have a number of interesting bills on the agenda for the viewing audience. And without further ado, I will hand off to my esteemed co-chair, Senator Anwar. Good afternoon.
Good afternoon, Mr. Chair. I just wanted to say these are very important bills that we'll be looking at today. Looking forward to having a conversation and supporting these bills. I have good news and I have bad news. The bad news is I'm not feeling well. I have got a cold. It's not COVID. The good news is I won't be speaking a whole lot. So that gives a little bit of more time for all of us to have conversations on other things. So thank you so much.
Well, we will miss your thoughtful comments, but given the kind of life you lead, I'm amazed that you're able to get sleep on any given day. So take care of your health and we will carry on. Good afternoon, Senator Wong.
Thank you, Mr. Chair, and best of health to you, Senator Anwar, and the good work that you do as frontline healthcare providers. So God bless you. I thank you, Mr. Chair. You're right. There are many interesting bills in this, and I appreciate that this committee has taken on many of these are very important issues. And I think as we look at as we move toward the end of our JF meetings, that we have been able to maintain a respect and decorum despite differing viewpoints on some of these policy issues, and that I give great credit to our leadership in that regard, and I hope we continue moving forward on that. Thank you, Mr. Chair.
Thank you, Senator, and I concur. Let's keep that streak alive of civility. I do not see our other ranking members as of yet. I'm sure they will be joining us shortly. It's also conceivable they have other engagements. So unless there's any further comment, I would like to move on to today's agenda. The first item on today's agenda is Senate Bill 254, an act requiring long-term care facility residents to undergo a criminal history and sexual offender registry search. This is a JFS. Do I have a motion?
So move, Senator Anwar.
Seconded by Representative Foster. Okay. This bill is different at this juncture. The JFS language is significantly different than the original bill that was proposed to this committee. It really focuses on establishing a 10-member task force to study the methods of ensuring staff and resident safety in long-term care facilities with a resident who appears in a state or national sexual offender registry database. Under the bill, the chairpersons of the task force will include an alliance in Connecticut aimed at ending sexual violence and an association of healthcare employees of New England. The point being, we want to have people who are really able to represent those interests on the task force. And it requires the task force to report its findings to this committee by January of next year in time for session. So rather than tackling the very difficult subject of administering such a program, we're going to explore it, understand how other states are doing it, and come up with something that fits the state of Connecticut. Are there comments or questions? Seeing none. Gee, I'd love it if somebody would suggest.
I move.
Oh, I'm seeing Representative Zupkis. It's nice to hand.
Thank you. Thank you, Mr. Chair. May I offer that we start a consent calendar, please?
Boy, you're reading my mind, Representative Zupkis. Thank you for doing.
You're welcome. And would you please leave the votes open?
Oh, that's a certainty. We will probably go to at least 4:30, 5 o'clock, but we'll see how today's proceedings go and to see if that's adequate. If there are legislators you're aware of who are in transit,
Mr. Chair,
conflicts and will unable to be done by, say, 4:30, let us know.
Mr. Chair,
Yes, Madam Administrator.
can we keep it open until 6:30, please?
If you insist, if you're really eager to keep it open that long, 6:30 sounds great. Okay, so be it. And again, thank you, Representative Zupkis. I see no objections to the creation of a consent calendar, and I presume you want us to create it in order to put an item such as the one before us on such a consent calendar?
Yes, sir.
Are there any objections? Seeing none, we will add 254 to our newly created consent calendar. Thank you, Representative. Next on our agenda for today is Senate Bill 329, an act concerning the retail operation of optical establishments, offices, and stores. This is a JFS. Do I have a motion?
So moved.
Moved by Representative Gilchrist again.
Second.
Seconded by Representative Berger-Givallo. This is a bill that is clearly a work in process. We are attempting to wrangle with a new business model for those seeking to obtain prescription eyewear. And there's a specific instance whereby we are one of only 2 states that prohibits keeping such an establishment open.
What Senator Burgell said. I am going to support this out of committee.
Henry, you got to mute. Thank you. As I was saying, we are one of 2 states that prohibits an establishment selling such eyewear from remaining open when an optician, effectively an eye professional, is not present in the store because of concern about potentially a bad outcome in the creation of eyewear for that individual. We have engaged parties on both sides. We've heard some very strong testimony from the optical establishment, if you will, that remain concerned about potentially bad outcomes if such a rule was allowed. We are currently in the process of working with parties on both sides. Representative Berger-Givallo, who will speak next, is taken on the perhaps unenviable task of trying to figure a way to make everybody happy. And I am hopeful that we can reach such an accommodation. So I am asking this committee to get the bill out of committee so these negotiations can continue with the understanding and assurance that if we can't reach an accommodation, the bill will not move forward to the floor of the Senate. I will now move on to Representative Berger-Givallo, followed by Senator Wong.
Thank you, Mr. Chair. I will tell you, I came into this with absolutely, I wasn't even on a fence, never mind leaning toward one side or the other, because I knew so little about what it was that we were trying to find that compromise on. So the number one question I was asked by my colleagues as I started to explore this was, why is Warby Parker asking for this and no one else? And this is definitely a different business model than a lot of the businesses we would compare it to, like a lens crafter, for example, where Warby Parker has one unique store that offers all of the pieces, all of the elements that the umbrella company that owns LensCrafter does in multiple stores. So for example, if LensCrafter has to close because they don't have an optician, they have Sunglass Hut right down the hallway in the mall that is still open. Warby is unable to do that. Warby does employ roughly 55 people in the state, and they plan to grow that. Whenever they do close their doors, they also have to send their employees home. So this is obviously hurting employees, and it makes it difficult to hold on to employees if they are not guaranteed to be held on for their entire shift. When asked if they would support increased penalties, we all heard in the hearing, and I have heard it reiterated again in my follow-up conversations. Would they support increased penalties for violating and you know, if anybody actually had someone in the store, if the optician wasn't present? And immediately everyone was for an increase in penalties. They were okay with that. So I'm not getting that they're trying to shirk that. This is a different kind of business model, and I think that we're all seeing in our malls and our strip malls that brick and mortar stores are going out of business and they are turning to an online model exclusively. This is a company that was a really strong online model, and they're coming into our state and they're putting stores in. So it's kind of turning that upside down, and it's doing what we want, which is creating jobs in the state. And I do not get the impression that anyone is trying to order, sell, or dispense any kind of prescription eyewear without following the letter of the law. This is strictly a function of being able to stay open to create a better customer experience and to be able to keep their employees on the clock, essentially. I think at this point, I think I can probably wrap it up because I think we've talked about this a lot. But I will definitely be supporting getting this bill out of committee today.
Thank you, Representative, and thank you for volunteering to take this on. I remain hopeful, not necessarily highly confident that we can find a pathway here. Senator Wong, followed by Representative Gilchrist.
Thank you, Mr. Chair. I want to thank Representative Berger Javallo for her explanation and her efforts into this. I certainly hope that based on that role that she will keep an open mind in regards to this policy moving forward and consider all viewpoints on that. That being said, for me, the biggest concern I have is in regards to the eye care professionals industry that we're talking about. This is not a commodity transactional business in my mind. Our optometrists and opticians were considered frontline healthcare providers during the COVID pandemic. Those organizations were open because they were considered essential healthcare providers fighting through and enduring the dangers of the COVID pandemic. And it's important to note that. And a major component of this bill is to ensure that we have a licensed practicing optometrist on staff when the facilities are open. That's an important element as I read it in the bill. That is an important point of consideration, that having a healthcare professional addressing the very important aspect of vision and eye care is an integral part of this policy discussion. Another important discussion for me as a point of consideration is many of the optometrists who submitted their testimony, I had an opportunity to engage with them. These are small business owners that own the businesses. They're part of the community. And I appreciated the testimony of the representative from Warby Parker, who offers some very, very important viewpoints. But I think when posed to the question, do you own those stores, or does the industry or the business, Warby Parker, own the business? And he said, Warby Parker owns all the stores. And another important question that I came from that discussion and engagement was, are you free to make any decisions or conversations or comments? And one thing that really kind of piqued my interest was, he says, I'm not authorized to make that decision. It goes up to corporate. That is one of my biggest concerns, is so many of our stores that spoke out are small business owners that have endured the incredible challenges of this economic upheaval that we've endured from COVID. And they're there. They're part of our, food baskets for our PTAs that supported Little League teams. They are our small businesses in the community. And I know there is an important emphasis on a free market, and a new business model has been articulated. And perhaps, forgive me, in some cases, I am a believer in supporting our local small business owners that are very fabric of our community. And indeed, if there's a conversation moving forward, I hope it's a dialogue that continues, but certainly not from a state policy dictating to what these local businesses are trying to do in perfecting an important healthcare service to the community. So on that point, I'll be voting no on this bill. And I hope that as this continue to work moving forward, that all the decision makers and policy implementers will have an open mind in regards to respecting the balance between new business model, big business, versus our small local business owners that are our community's very, very essence of the fabric of our community. Thank you, Mr. Chair.
Thank you, Senator. I think we all concur. Our responsibility here is to protect the public health, but we cannot ignore the changing consumer preferences and needs, and also new business models. And I take your point that we're trying to strike the right balance. By definition, our job needs to fall on the side of safety first. And that's what we're trying to accomplish here. Representative Gilchrist, followed by Representative Zupkis.
Thank you, Mr. Chair. I had used Warby Parker when it was primarily an online product. And when this bill came before our committee again this session, I went on a tour and then decided to try to use the brick and mortar Warby Parker. And so went in, tried on glasses, and when I picked a pair that I did find very cute, I submitted Warby Parker needed to have my eye doctor's office send my information so that they could fill the prescription. And I will own that I hadn't gotten a checkup as I was supposed to. And so my prescription was out of date and Warby Parker would not fill the prescription. And I think one of the issues that's been brought up with this bill and these discussions is how can we trust or know that Warby Parker will play by the rules? And I just want to share that even though for convenience sake, I was hoping I could get my prescription filled, they would not because they are playing by the rules. And so I do see this as a new business model that we should support here in the state. And so I am hopeful and looking forward to working with Representative Berger Javallo to see if we can find some language that works for everyone, because I think this is something that folks want here in our state and we should support Warby Parker here in the state of Connecticut. So I'll be voting yes today. Thank you, Mr. Chair.
Thank you, Representative. Representative Zupkis, followed by Senator Haskell.
Thank you, Mr. Chair. And Senator Huang, he actually said some of what I was going to say. So I just have a question. This bill allows certain things and prevents certain things. How is this going to be enforced?
I think that's an excellent question, Representative, and one that we've talked about since the inception of this bill being proposed. There are clear penalties, but there is not necessarily an easy mechanism other than somebody effectively reporting on an establishment in violation. There is not necessarily, as we have for certain other things with the Department of Consumer Protection, any sort of mystery shopper experience, but I would say that's true of the vast majority of businesses in our state. It really is dependent on somebody noting a violation. So it is one of our concerns, is that how will we know if such a law is being followed and not abused?
Thank you for that answer. And that is one of the reasons that I will be a no today until that gets worked out, because we're creating legislation and laws, but it's difficult to enforce. So why are we even creating them if there's no enforcement? So I hope that gets worked out as well. And again, for that reason, I will be a no. Thank you.
Thank you. I will say that we have, anecdotally Representative Gilchrist's testimony that they seem to be good actors, and the vast majority of businesses in our state really fall in the same category. There's an expectation of following the law for everybody. And in this sense, even though there may not be an easy enforcement mechanism, the expectations remain the same.
And I'll just add, thank you for that. And I know there's been other bills passed out of this committee where it's been forced on certain segments of an industry to have to post certain things and other segments not to. So I just hope it all stays consistent and that it will be able to be enforced. Thank you.
That is our goal, Representative. And I do believe that the language that's been proposed would have certain signage posted helping consumers understand why a particular store may not be able to fulfill its desire, someone's desire to get their prescription filled if an optician is not on premises. So there is supposed to be signage in store that would make that clear. Senator Haskell, followed by Representative Claridis DiTria.
Thank you very much, Mr. Chair. And I want to echo the good comments of Representative Berger Gervalo. This is one of those issues where you arrive in the legislature and don't necessarily have a strongly held opinion and quickly find out that it's far more complex than at least I ever anticipated. I just wanted to say that I've sat with the optometrists in my district. I've learned from them over the last 2 or 3 years. Ultimately, I've decided that I'll be voting yay today, largely because I believe that our goal in this committee is to not just make sure that the public is healthy, but that the access to that healthcare is convenient, is accessible to all. And this to me comes down to a consumer convenience issue. So I'll be voting yes, and I appreciate the chairs bringing this issue before us. I also appreciate that the optometrists in my district may not agree with me on this vote, but I certainly have done my best to understand their point of view and appreciate the time that they've given to me in digging through this complicated topic.
Thank you for that, Senator. Representative Clarice Dietrich, followed by Senator Anwar.
Thank you, Mr. Chair. Question, and someone may have already asked this, I apologize, I jumped on. Are opticians licensed and registered by the state of Connecticut?
That's my understanding, yes. They have their own licensing procedure.
But do they have to be licensed in order to work in a store or an optometrist office?
That's my understanding.
Okay. I was under the impression that they don't have to be licensed if they're working in a doctor's office, as long as the doctor's there in the same building.
I was unaware of that. It may be possible. Is there a point you wish to make about their licensure?
If we license so many occupations in our state, for example, our nail techs have to be licensed. So if I would think our opticians, if they're licensed and registered, and my question is whether they have to have someone there with them or not, if they're licensed, and if they can be there by themselves, if they're not licensed or registered. So that's my question to you, Mr. Chair, and maybe I can find out the answer at some point.
Yeah, thank you. Again, I may not be up to date on the latest information, but at least in the context of what we're referring to in these kind of optical establishments, the presumption is that these are licensed opticians.
Okay, we know what happens when we could possibly presume or assume. Thank you.
That's certainly true, and we're glad to confirm that that's the case, which I do believe we should have an expectation that is so. Senator Anwar.
Thank you, Mr. Chair. To Representative Clarice Dietrich's point, I just wanted to start that they are licensed and they can practice independently or be present independently for the opticians. I wanted to just mention that first I wanted to thank Representative Berger Gervalo for her efforts in trying to get as much data and information to help us make the better choice amongst the various options we have. I also want to share my thoughts that to me, protecting the professions of opticians is critical. We do not want to dilute their capacity to and devalue their work and training in any shape or form. The initial version of the bill suggested that it would, but I know that there's a clarity that is understood by the industry, but also by many of the opticians that this will be protecting them if we were to move forward. And as we are trying to look at ways to protect them, including penalties if wrong actions are taken, or taking the bill back again and fixing it if they are not moving in the right direction and then they're not following the promises that they have kept. I do feel it's worthy to get this bill out of the committee and make sure that we tighten the language to make sure that the profession is protected. And with that assurance and with that understanding of that language, I will be voting this out of the committee as a support, but looking forward to working collaboratively to make sure that we protect our opticians in our state. Thank you, Mr. Chair.
Thank you, Senator. And we share your desire to make sure that we are protecting the profession of opticians generally and in this specific instance. Representative Kavros DeGraw, followed by Representative Terciak.
Thank you, Mr. Chair. And I have to say, I find myself associating with a lot of the comments that have been made because it's not one of the issues that I thought I would be wrestling so hard with when I got to the legislature. And I am grateful for all of the data that Representative Berger-Javallo has provided us. You know, I've had experiences not with Warby Parker, but with Lens Crafters, and I think that they've done a really good job as the same kind of or similar kind of chain. I know they have, you know, a different setup than Warby in that they have other brands that they use, but I think that, you know, they are probably our best and closest example of good actors in the space. And I certainly hear, you know, what everyone said. We want to protect small business. We want to protect all of the opticians, certainly. But I think that we also have the opportunity still to improve this bill if necessary. So I will be voting it out of committee today. And I also think that, you know, I do think about our malls that just become these big empty spaces. Where I grew up, you know, they ended up filming Wonder Woman there and then blowing it up. So we really don't want to, it's kind of a bizarre example, but Landmark is the name of the mall. You can look it up. But we do want to think about these things. And it was, I thought it was interesting that, you know, in some places where Warby's going in, they're already there and Lens Crafters is coming in. So to them, that's competition. So I do believe and subscribe to competition makes everyone better. And I think that that's what we're finding here. So I'll be voting it out today with a yes. Thank you.
Thank you, Representative. And this is by no means an endorsement of either Wonder Woman or blowing up malls. Representative Terciak.
Thank you very much. I don't see this as changing, as adding something particularly new that changes the way business is done with opticians. What's new about this basically is they want to be able to have one optician covering multiple states and and keep that office open even when there's nobody there, even when there's no optician there. My optician and his office, they close when he's not there. I can't go there to pick up the glasses I've already ordered and paid for. In terms, they're located in a strip mall. I like them, but I'm not in their favor because I don't want to have another empty shop in a strip mall. There's nothing, by the way, so different about let's take care of our own people. Representative Zupkis, I believe that your neighbor Ann is my hearing aid person. If I'm right, that's also Representative Jenga's hearing aid specialist, if I'm not giving away too much information. Hearing aids are also something you can do online now. You can go online, you can take the test, you can choose what color, size, kind, brand, and order it up all online, all without ever seeing a professional. I'm not sure that that is a good thing for Connecticut consumers. I'm not sure that it increases access. It may make it easier, but it's certainly, I don't see any connection to expect better quality. So I'm going to be a no at this time. I just don't see it, don't agree with it. I think it's all about not wanting to pay people to be present and do things as inexpensively as they can. I'm not necessarily in favor of that while we scream jobs, jobs, jobs. Thank you very much, Mr. Chair.
Thank you, Representative. Representative Berger-Javallo for the second time.
Thank you. I also was operating under the impression, mostly from hearsay, that there was a desire to have one optician who floated around and made multiple appearances at stores. There's no evidence of that, just to be clear. And again, I thought that was the reason for this. But there is no evidence of that. This is not something that the store themselves have expressed a desire in having. And in fact, they did tell me that at one point there was one afternoon where there was one person. And so they opened up a store and closed a store at the same time so they could try and get to as many patients or customers as possible in that day. So that may be where that misunderstanding is coming from, understandably. And just to kind of go back to one of the other points that was made, I think that Rep. Gilchrist made it very clear that under no circumstances will there be any medical engagement without an optician present. That also means that even if they have an optometrist in the building, if there is no optician there, they still cannot let a customer in. So even though the person, and I think we talked a little bit in our meeting about the hierarchy, we've got the opticians who are licensed and they can measure for the eyewear. And then we've got optometrists and ophthalmologists, and that's sort of that doctor hierarchy. Even if there's an optometrist on site, if there's no optician, the doors must be closed right now. So I just wanted to clarify that. And the last piece is for Warby, between 10 and 12% of their sales are from non-prescription items. So that is all for the second time. And thank you very much, Mr. Chair.
Thank you, Representative. We've all been seeking that statistic on the non-prescription sales, so it's good to have that. You know, one of the distinctions that we've been very careful to make in this committee is that eyewear in this context is not an accessory item. It's a medical device. And that's why we're being extra careful to make sure that the entire process, soup to nuts, from desire for new glasses, the prescription, the frames, the fitting, the checking to make sure that it came through correctly as per the prescription. These are all part and parcel of a medical device that conceivably, from what we heard, could have extreme negative repercussions for those if the process is not addressed properly. That's what we're trying to protect here, while we are fully open-minded to facilitating new business practices. Are there any other questions or comments? If not, Madam Administrator, I think we're ready for a roll call vote.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner, Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong,
Senator Huang votes no.
Representative Pettit, Representative Arnone,
Representative Arnone votes no.
Representative Berger-Givallo,
Representative Berger-Givallo votes yes.
Representative Carpino,
Representative Carpino votes no.
Representative Cook, Representative Dauphiné,
Representative Dauphiné votes yes.
Representative D'Amico,
Representative D'Amico votes no.
Representative Elliott,
Rep. Elliott votes yes.
Representative Foster,
Rep. Foster votes yes.
Representative Django,
Representative Django votes yes.
Representative Devlin.
Representative Green,
Representative Devlin votes no.
Votes no.
I did not see you, please.
Representative Green votes no.
Thank you. Senator Haskell,
Senator Haskell votes yes.
Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Clarice Detrier,
Representative Clarice Detrier votes no.
Representative Linehan,
Representative Linehan votes yes to continue the conversation. Thank you.
Representative McCarthy, Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Tersiak,
I'm sorry, Representative Tersiak votes no.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Senator Kushner, Representative Pettit, Representative Cook,
Representative Cook votes no.
Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. Once again, we will be holding votes open until 6:30. This is a Friday afternoon. We know people have other things going on. I've been advised, for example, that Representative Betts has an urgent family matter and may miss our votes. Everybody's doing the best they can. All right, we will move on next to item 3 on our agenda today. Senate Bill 369, an act concerning the Department of Developmental Services recommendations regarding various revisions to developmental services statutes. This is a JFS. Is there a motion?
So move, Senator Anwar.
Representative Young, seconded by? By Representative Gilchrist. Thank you. This is exactly as it seems. It is a number of various revisions to developmental services statutes. Not much here. Allows the DDS commissioner to require applicants seeking employment to submit to a check for substantiated complaints in the DCF Child Abuse and Neglect Registry. Specifies that the governor's physician appointee to the Council on Developmental Services excuse me, must be a Connecticut licensed physician or psychiatrist rather than a physician generally as under current law. And 3, allows the DDS commissioner's designee rather than just the commissioner to perform certain tasks related to the probate court process to place individuals with DDS for services. Pretty straightforward. Representative Zupkis.
Thank you, Mr. Chair. Would it be possible to put this on the consent, please?
It would certainly be possible. Let's see if it's going to happen. It looks like everybody's okay with it. Senator Wong has his hand raised. Is that to object to the consent calendar, sir?
It is. I'd like to ask a question, if I may, Mr. Chair. I wanted to respect some of the concerns raised by probate court in regards to this bill's impact on the probate judge's ability to make some determinations. And I wanted to refer to the excellent testimony provided by our joint probate judge, Judge Lisa Wixler, in regards to her concerns on this bill, wondering if the substitute language addressed those concerns. Through you, Mr. Chair.
Thank you for the question, Senator Wong. Yes, we took her, we listened to her testimony with great interest. My understanding is that the JFS language we are looking at right now specifically addresses the concerns that she raised. I do believe that this is satisfactory to those who are concerned on behalf of the probate court.
Thank you. I appreciate that clarification. And with that clarification, in regards to accounting for the concerns offered by the testimony, I have no objections to the consent. Thank you, Mr. Chair.
Thank you, Senator. Any other comments, suggestions? If not, we will add item number 3, Senate Bill 369, to the consent calendar. Item 4 on today's agenda is Senate Bill 448, an act concerning the delivery of healthcare and mental health care services to inmates of correctional institutions. This is also a JFS. Is there a motion?
So move, Senator Anwar.
Moved by Senator Gilchrist, seconded by Senator Anwar. Got it in there. Good. This is a big topic. Anyone who has followed the travails of our Department of Correction with regard to healthcare over the past number of years recognizes we can do better. That we saw during the pandemic that those who are incarcerated were in many ways as disadvantaged as any other population in our state. And we had healthcare delivery quality issues prior to the pandemic. This bill begins the conversation about how we might address some of those things. It is by no means a solution in and of itself. And there needs to be a much broader ongoing conversation how best to serve those who are incarcerated in the state of Connecticut. I will say that it is an excellent good faith effort to accomplish that initial step. And let me go over a few of the things this bill addresses. It requires the DSC commissioner to ensure that there are a sufficient number of licensed mental health providers at each correctional institution, something we would assume that would be the case. Specifies the circumstances under which these providers may prescribe or administer psychotropic medications to inmates. Requires that each inmate receive a routine physical exam when entering the institution, an annual physical exam, and an exit health interview conducted by a physician, PA, or APRN. Requires these providers to administer an HIV test to each inmate who requests one, and to offer an HIV test to those identified as high risk. Requires a mental health provider to interview each inmate upon admission regarding the inmate's drug and alcohol use history. Generally requires correctional institutions to transfer inmates to a medical unit if they are experiencing alcohol or drug withdrawal. Excuse me. Requires the York Correctional Institution to immediately transfer to a hospital or outpatient clinic any inmate who is pregnant and seeks an abortion before the viability of the fetus. And 8, establishes an advisory committee to advise the DSC commissioner on prison health care and evaluate whether the Department of Public Health should have oversight over healthcare services at these facilities, which I might add was once the case. I think this advisory committee is every bit as important as the other steps that we're going to take, because it's a commitment on behalf of the state to make sure we really evaluate the healthcare circumstances in our correctional facilities and comes up with a plan for a much better way of delivering it. Senator Anwar, followed by Senator Haskell.
Thank you so much, Mr. Chair. This bill is an important bill. This is not only about being morally right, but also being strategically right and financially being right for the taxpayers of the state of Connecticut. Every year, there are lawsuits that the state of Connecticut has to deal with. And unfortunately, each and every, or most of them, are open and shut cases because of the quality of care and the fact that the standard of care is not practiced. And then if we study some of those cases, it's heartbreaking. And if you interact with the people who have been negatively impacted or their families, you realize that we as a state can do better than what we have been doing. And that's why this bill becomes very important. I know, and I wanted to thank all the people who came and testified. One of the requests that a number of people who testified was to change the name of the title from inmates to incarcerated individuals. That was our intent. The challenge is that in the legal process for the entire state of Connecticut, if we were to change that, we would have to change that from inmate to incarcerated literally in every part of the state laws. That is a lot of work, because that means that changing the word in every law that exists, and then that was beyond the bandwidth in this short session. And as Mr. Chair, we have had a conversation. We can look into that and then make sure that the words do matter, and we can fix that in future. But for the purpose of this bill, we would probably have to keep it this way. Otherwise, this bill would not go further. So we feel that the current name is important because we'll be able to keep things moving for what needs to be done. The second part is that having an advisory committee to actually look, and then the makeup of the advisory committee would include individuals who have some experience, along with the members of the Department of Public Health as well as Department of Correction, is going to be critical. And having a plan of action for the oversight by the DPH as well. Now, Monday, we're going to hear about whiting and some of the other components where we have, as a legislature, asked for Department of Public Health to oversee a state group. And this could be another situation where we may actually end up having to do that. And this committee is going to coordinate and help us in that effort going forward. So it's a step in the right direction. I know each and everyone would join us to say that the status quo is unacceptable to us. This is actually breaking that status quo and moving in the right direction, and making sure that we are legislating the quality of care that has been defined by lawsuits against the state of Connecticut. And amongst the victims, I can tell you from the records, it appears that the female incarcerated individuals have been one of the biggest victims in the poor health quality of care that has been provided within the Department of Correction. And that's an area of opportunity that this bill is going to address in a much better way. So I would encourage my colleagues to support this and move this out of committee, and we continue to move in the right direction as a state. Thank you, Mr. Chair.
Thank you, Mr. Chair. To follow up on your first point, for the benefit of the public, words matter, labels matter, and we would like to make the change that has been suggested by those who are closest to it. Use of the word incarcerated versus inmate is something that we hope to achieve. But to give you an insight into the statutory process, it's conceivable that the word inmate is mentioned more than 100 times in state statutes. It is not a trivial task. Well, maybe it's trivial, but it's a lengthy task to make those changes throughout all the statutes of the state of Connecticut, which is why, even though we're eager to do it, we would not do that to our committee lawyers with everything else we're asking them to do. This is precisely the kind of thing which we can work on during off session. And when we come back in, it can be added into our tech bill so that those changes are made. And in fact, there are any number of instances where we have done that and changed terminology in the statutes, which, as you can imagine, in many cases date back over 100 years when the world was a different place. So we will definitely be taking up that change sooner or later. Senator Haskell, you had your hand up, and I now see it's down. You no longer have a question?
Senator Anwar answered my question, Mr. Chair. So thank you very much.
Thank you. Representative Linehan, followed by Representative Gilchrist.
Thank you very much, Mr. Chairman. My question is, do these provisions, the guidelines, the benchmarks, do they provide, are they for the Manson Youth Institution as well, or is it just for adult prisons?
I believe this applies at all institutions, perhaps with the exception of Whiting.
Great, thank you. And then one last question. Was there a reason why the HIV test was is only to be offered to those who are high risk and not to everyone?
To be clear, it is available to all those who are incarcerated if they so request it, but special attention is given to those who are considered high risk.
Great, thank you very much.
Thank you. Representative Gilchrist, followed by Representative Carpino.
Thank you, Mr. Chair. Just want to speak in support of this legislation. Just because you become incarcerated in the state of Connecticut doesn't mean you lose your human rights, which include access to health care. And appreciate all the advocates and my colleagues who have worked on this legislation. As a member of the Appropriations Committee in past years, and including this year, we've heard from staff. So not only does this legislation have the potential to impact incarcerated individuals, it will also positively impact staff at these institutions who have come before the Appropriations Committee to share just how painful it is to be the one staff member for more than 200 inmates who they are expected to provide mental health care for and know they can't do that. So I look forward to these conversations continuing in future years. Thank you.
Thank you, Representative Gilchrist. Representative Carpino.
Thank you, Mr. Chairman. I agree. We can do a much better job with our inmates and those who are incarcerated while they're wards of the state. However, I'm not convinced that this is the bill that's going to do that. I'm concerned that we're passing a very comprehensive bill out of committee that asks us to establish an advisory committee telling us what we need to do. So in my mind, I don't really understand why we're passing a bill with major changes and including an advisory committee in that bill. Perhaps I'm overly simplistic, but we should be studying the problem and coming up with solutions before we're passing a bill with a number of suggestions. If we really want to make holistic changes, we should be studying it in great detail with individuals who have been in the system as well, who can share their input, because I think that's very important. I think this is the proverbial cart before the horse. I have a number of questions that I will continue to seek out answers to between now and the floor. Why are we talking about providers per facility as opposed to system-wide, knowing that individuals and their needs change? Why are we getting involved as to what medical providers can prescribe and when? transfers, and if an individual has no symptoms, are we giving routine exams in and exits out regardless of length of stay? Should there be qualifiers so that we can prioritize the number of individuals that we have? Simply said, why aren't we offering HIV tests to somebody who requests it or needs one now? And how are we best going to address alcohol and drug withdrawal? So those are just a few of my questions that I hope to look into before it hits the floor. I understand the intent. I agree with the intent. We have to do a better job. I have followed those lawsuits. I understand what the financial implications have been to the state because of them, and the long-term and very sad implications to the individuals and their families that those awful situations have occurred to. But I can't support a bill right now when part of it is to study changes, and it seems like it's a bit ad hoc, although well-intended. I can't support it out of committee, sir.
Thank you, Representative. You make some good points. Let me make an effort at least to assuage some of your concerns with regard to the points that you raised. I do believe that the advisory committee is the key element in this, to your point, because the problems that the department has faced with regard to taking care of the incarcerated are systemic, to your point. That's why we should be looking system-wide. However, I don't view this as a comprehensive bill by any stretch of the imagination because of the complexities involved. And in fact, the things that we're enumerating here, as I kind of alluded to earlier, we would presume they were doing already, and that these are fairly common sense processes and protocols that we hoped would be in place, but we want to ensure are in place. And I do not view it as prescriptive in terms of telling medical professionals at the facility what they can or cannot do, as much as call their attention to things they better be very focused on to take care of these patients. And I just want to add that there's a measure of urgency in this, that even with our desire to get it right and use an advisory committee, the needs are immediate. And if we can get some of these things in place now, assuming that perhaps with the good representative's help, we can get the language right, it will make a good initial start on dealing with longstanding problems.
Thank you, Mr. Chairman. I look forward to seeing what the advisory committee recommends.
Thank you, Representative. Representative Zupkis, followed by Senator Anwar.
Thank you, Mr. Chair. And I completely agree with what my colleague, Representative Carpino, just said and hit a lot of my points. I do have some other points that are concerning of things required in this bill. One is the DOC commissioner ensuring there's a sufficient number of licensed mental health care providers. And I think that's important. How do you ensure that? What if we can't even hire the people because there's an issue right now with hiring these folks? This ensures that it happens. I hope we would not hire people that are less qualified than needed to be qualified. And I'm not saying that's going to happen, just the language is very strong there. And I know we have a problem across the state with this. Some other things is the number 7 at York Correctional Institute, and how transferring ladies who want an abortion out, and understanding that could not happen in a facility, in a prison. However, I would hope we are offering the same service to folks who want to keep their children, that they are getting both ends of the spectrum here, and they are being educated on both of those issues in the prison system. Another concern I have is that this seems like an awful lot for DPH to take on. I constantly hear from all the agencies, we're understaffed, we need more work, we need more workers, and that they're crying, I guess not complaining, but crying out for help because they struggle to do what they do now and what's required of them now. And now we're piling more on DPH. We've got 2 commissioners, is one looking over another's shoulder. So those are some of the things beyond what Representative Carpino pointed out. And I'll say, as I normally or a lot of times say, that I don't know that we have analyzed, I've surely not heard anything we're doing already and what is working and not working in the system. Obviously, there are things that are not working, but have we analyzed what we're funding? And if it's not working, as it's not because we're having to do these things, let's stop funding some of that and put that money to these good uses. So I would hopefully say that we could analyze some of that information and maybe this group can do that.
Thank you, Representative. That's indeed the purpose of the advisory committee, is to do that kind of evaluation. To your point, we know it's not working and we know we can do better, but we need a plan for moving forward. And to your point with regard to putting more responsibility on DPH, that's something that is very much on all of our minds. People may recall that some years ago, DPH was responsible for delivery of healthcare at the Department of Corrections. There were some problems. They were significant enough that the decision was made to relieve DPH of such responsibility. And the solution that we came up with is the current circumstance, which is also not working well. So we're not throwing this back to DPH without careful forethought and also, to your point, consideration of the resources they will need to deliver quality care, which perhaps they didn't have before and led to some of the problems that we're facing. So we recognize we have a problem that cannot be ignored, and we want to be deliberate about the advisory committee, but we also feel a responsibility to make a start on, as I said, some common sense steps to ameliorate the situation to the degree we can before we even have a chance to determine what recommendations we would make to make changes about funding, about staffing, all those things, until such time as we've had the advisory committee come back to us. I can hold in my head the two thoughts of the long-term plan under the advisory committee and making some pretty straightforward changes to the way healthcare is delivered at the institution to make sure we can protect those that we've already identified who are at risk. Senator Anwar.
Thank you so much, Mr. Chair. I just wanted to try and address some of the concerns my colleagues have raised. I just wanted to start by saying that, again, I know all of us are doing hundreds of different things, so we don't have the luxury of analyzing each and every aspect of the bill that we look at. So just because one individual may not have analyzed that does not mean the analysis is not being done. And that's something we all appreciate about each other because of our bandwidth issues. For this issue, this issue has been there for the past 34 years. When the first big lawsuit that amongst a lot of previous challenges, for 34 years, this issue has been at the forefront. A big lawsuit that the state had lost resulted in guidelines what needs to be done. For 34 years, those guidelines have not been followed. So if people want more time, I need to know, is it 40 years that they want these guidelines to be out there without being followed, or 45 years, so we can actually tell all the incarcerated people that some of the legislators want to study this for another 4 or 5 years because 34 years isn't enough for them. So that's something I want to put on the radar screen for everybody, that this is not a new issue. And for the studies that has been done and spoken and cried about as well. Our Black and Puerto Rican caucus has been front and center on this issue. When I actually joined in 2019, I was able to hear public hearing that was nothing short of heartbreaking, because I got to interact and see all the parents of the family members who had died. They had gone to prison for a small problem and they never came out because their health care was not there. They were not treated. Their conditions were not identified. When an 18-year-old dies because of a preventable condition and there's no medical records for this, that becomes a problem. When a woman is delivering a child in the toilet, we have a problem. And that's what this is about. And there's so many stories. And the Department of Correction, when they come, and they came in a public hearing, and their testimony for the most part was that we are okay, everything is fine. Yes, we could use a little bit improvement, but we are happy with where we are at. And that is unacceptable to me, and I know it's unacceptable to most of us, because the victims who have been impacted by this is a problem, and the courts have ruled against our state. many a times. So we will continue to pay for this unless we address this. Again, with respect to the committee, the advisory committee, it closes the feedback loop, because it's important to keep track of what's happening, because if we don't have that, we will actually be back over here again, because we will continue to hear that everything is fine. And we know that everything is not fine, because we are hearing that right now and we know it's not. So we need to complete that feedback loop, and that's the purpose of that. And the Department of Public Health is better equipped than any other department to do it. And this would not be the first time one department sees over the other. We have, as a legislature, asked that in the past as well. Unless you want to create another department, then again, we don't have the resources for it. The common sense approach is to approach it in this manner. So again, there's answers to all of these questions, and I can give them right now or in the next, whenever they are needed. Thank you, Mr. Chair, for the second time.
Thank you, Senator. Representative Berger-Travallo.
Thank you, Mr. Chair. With the full acknowledgement that I have asked questions that have been answerable if I have gone through the entire bill, because there is so much for us to read through and to be prepared to vote on as we come into these meetings. I just wanted to highlight that Section 5 does actually have a pretty comprehensive explanation of the pregnancy and prenatal care provisions in the bill. So just to kind of, if you need a speed check, go right to Section 5, and that should answer a lot of the questions that were being asked. Thank you, Mr. Chair.
Thank you for that guidance, Representative. Senator Wong.
Thank you, Mr. Chair. And it's been very helpful to hear the various perspectives, and many of our colleagues have raised the concerns that I have. But before I wanted to reiterate that obviously our correctional facilities and those that are incarcerated have suffered dramatically during the COVID, and it has raised the alarm of the disparity in some of the care that is necessary in those that are incarcerated. I believe it is a proper and a humane aspect that we're undertaking here in regards to healthcare for those that are incarcerated, because they are our fellow humans. That being said, I think the challenges also raise in the devil being the details. There are so many questions that are unanswered as we explore the broader population in regards to healthcare and preventive care. You see in COVID that certain communities are exasperated by some of the challenges and the disparity of care. We saw that in the correctional culture, and this bill is a well-intentioned way to address it. But it needs more thought, needs more process. It needs a better prioritization in our budgetary process. We're about to undertake in a couple of other additional bills, a comprehensive mental health bill that has a price tag that I don't even think we're fully vetted yet. But again, I do believe, and I will be supporting this bill out of committee, but open up the reservation in regards to concerns over the implementation, the proper funding, and the proper thought process. I think having the working group is a good start, but the points that this bill is trying to accomplish are not even issues that we've been able to accomplish in the broader marketplace for our constituents. So it is a tall undertaking. It is a necessary undertaking, but I am cautious about what this bill's effort is looking to do. But I hope we continue this process moving forward, and I'll be voting in support of it, but heeding caution that it's a lot more work, as my colleagues have mentioned, that we need to address. So thank you for the opportunity to share those thoughts, Mr. Chair.
Thank you, Senator. And I totally concur with your point with regard to adequate funding. As you alluded to, we'll be talking about a very large bill, for which the price tag is significant, and we don't even really have a fiscal note on it yet. But this is the story of Connecticut. Right now, we are awash with federal ARPA funds that we hope to apply productively to address immediate urgent concerns. But the state has suffered from fiscal distress for so long that we have consciously shredded our healthcare safety net over a period of decades. And those sins have come home to roost with us now. And the funding we need for so many different services across the board, include the Department of Corrections. And indeed, perhaps many of the problems that we have seen over the past decade or more have been the direct result of insufficient funding for healthcare there. So everything we do is predicated on coming up with sufficient funding to do the job. I think there's nothing more frustrating for we legislators than to see that the best we can do is put in the bill available appropriations that hopefully there'll be money available to do this task. It's not good enough, and that's why we have these problems. So we very much take your point to heart, and I hope all of us advocate on behalf of the Department of Corrections to get them adequate funding to provide, as has been said, just basic healthcare services to take care of people. Seeing no further comments or questions, I believe we're ready for a roll call vote, Madam Administrator.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner, Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong,
Senator Huang votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Representative Elliott votes yes.
Representative Foster, Representative Django, Representative Green, Senator Haskell,
Senator Haskell votes yes.
Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Clarides Detrier,
Clarides Detrier votes no.
Representative Linehan,
Representative Linehan votes yes.
Representative McCarthy, Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Tersiak,
Sorry there. Representative Tersiak votes yes. Thank you.
Representative Young,
Representative Young votes yes.
Representative Young, I did not see you on screen.
Representative Young votes yes.
Thank you. Representative Zupkis,
Representative Zupkis votes no.
Representative Dauphiné, Representative Foster, Representative Django,
Representative Jenga votes yes.
Representative Green, Representative McCarthy, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. Once again, we will hold the votes open until 6:30 p.m. today. Could everybody make sure they're muted? Thank you. Item 5 on the agenda, Senate Bill 449, an act concerning the recruitment and retention of physicians in the state. This is a JFS. Do I have a motion?
So moved.
Moved by Representative Gilchrist, seconded by,
Second.
Senator Anwar.
you see that? Who did that?
Senator Anwar.
All right, Senator Armour's going to get it.
Give it to him. Give it to the man.
Okay. Okay, this committee has discussed recruitment and retention of critical healthcare professionals in the state for a number of years. And as part of our broader effort this session to really put a focus on healthcare practitioner workforce, which is a problem not just in Connecticut, but across the country, we are proposing a bill that we expect will fit in with other legislation, including the aforementioned 5001, which we will discuss shortly, Senate Bill 2, which we passed out of this committee, Senate Bill 1, which is not of this committee, but is also related to this, as part of a broad effort to consider all the different ways we can provide quality access of the critical professionals across the entire spectrum, from the most specialized MD to peer support and counselors, to take care of the problems we have in the state, particularly as it relates to mental health. So this bill in and of itself is just a small piece in the bigger picture, but we have to be very open-minded about considering what we can do to both bring people to the state of Connecticut to practice and to keep them here, particularly after they put down roots, build up practices, perhaps done their school or their training here, to keep them here to take care of people here in the state. Once again, it's predicated, as you might expect, on adequate funding to do many of these things. But let me tell you briefly what's in this bill. And again, we will allude to other aspects in other legislation. This bill requires the Office of Higher Education, in collaboration with DPH and within available appropriations, there's that phrase, to administer a physician student loan reimbursement program. It's open to physicians employed in the state who've graduated from an in-state medical school or completed their residency at a state licensed hospital, and it provides reimbursement grants of 20% of the physician's student loan balance per year. It also requires the DPH commissioner to convene a working group to advise on ways to enhance physician recruitment. Among other things, the group must examine recruiting, retaining, and compensating primary care, psychiatric, and behavioral health care providers, the potential effectiveness of the loan forgiveness program, and any effect of the health insurance landscape on limiting healthcare access. So this is a small piece of a bigger puzzle. If we could put a lot of money against this, we do believe it would make a big difference to make Connecticut more competitive to other states, given that we're a high cost of living state. I urge everyone's adoption. And again, we will discuss other aspects of recruitment and retention in the context of House Bill 5001. Representative D'Amico.
Thank you, Mr. Chair. I happen to notice that in the substitute language, and correct me if I'm wrong, but it looks like the substitute language eliminated the section that was going to make a change to the covenant not to compete language that we passed a couple of years ago. So I was wondering if just wondering why that section was eliminated, or if, well, just would like to know why that was eliminated. That's my question.
Good question, Representative. Non-compete clauses is another topic that we've talked about in this committee year after year after year. And we've wrestled with it in the context that we do not want to impede a physician from moving on from their current practice circumstances to somewhere else in the state to take care of patients. Yet we recognize oftentimes that whether it's a hospital or the head of a practice group often makes significant investments to recruit and to train up and to build up the practice of an individual physician. And they have some argument that there ought to be some compensation or restriction on somebody effectively taking their practice with them, their panel with them, and going elsewhere. So we understand both sides of the issue, but we recognize in a small state like Connecticut, with a couple of very large systems, that it can be particularly problematic to do sort of a standard non-compete clause, which exists in a lot of these circumstances. And we also recognize that because of organizational and financial reasons, we're seeing fewer and fewer independent practices across the board. They're being absorbed by hospital systems, equity firms that are using them for profit generation. This is part of the changing landscape that we're dealing with. So we made a good faith effort to try to address the issues raised by those who find a non-compete problematic. We haven't quite figured it out yet. I will say that even though this section has been removed, I don't think this is the end of the conversation. I do believe we will continue to try to find a way that is equitable for both parties, recognizes that in a small state, there must be some places short of, the border where one can operate and build a practice. It's been excised for now, but stay tuned for further conversation, Representative.
Thank you, Mr. Chair. I appreciate that. I am heartened by your remark that the conversation will continue. So I will stay tuned and I will find it interesting, I'm sure. Thank you.
You can always find interesting things going on in the Public Health Committee. Are there any other questions or comments? Anybody want to make any timely suggestions about what we might do with this bill?
Mr. Chair, if there's no any concerns, should we add this to the consent calendar?
What a timely and relevant question, Senator. Are there any objections to adding this to the consent calendar?
Mr. Chairman, if I may,
Representative Carpino.
there are a number of members in transit, so while I will be supporting this, I would ask that we take a roll call vote.
Understandable. Thank you, Representative. I believe then we are ready for a roll call vote, Madam Administrator.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner, Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong,
Senator Huang votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Representative Elliott votes yes.
Representative Foster, Representative Django,
Representative Jenga votes yes.
Representative Green,
Representative Green votes yes.
Senator Haskell,
Senator Haskell votes yes.
Representative Cavers DeGraw,
Cavros DeGraw votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Claritas Dietrich,
Representative Claritas Dietrich votes yes.
Representative Linehan,
Representative Linehan votes yes.
Representative McCarthy, Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Young, I did not see you.
Representative Young votes yes.
Thank you. Representative Zupkis,
Representative Zupkis votes yes.
thank you. Senator Kushner, Representative Dauphiné, Representative Foster, Representative McCarthy, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. Once again, bears repeating, we're keeping the votes open till 6:30. We will now move on to item 6 on today's agenda, Senate Bill 453, an act concerning the Department of Public Health's recommendations regarding transfers and discharges of residential care home residents. This is a straight JF. Do I have a motion?
So moved.
We'll go with Representative Terziak on that one. Do we have a second?
Second.
Seconded by Representative Kavros DeGraw. All right. This bill modifies existing requirements for the involuntary discharge of residential care home residents to allow the residential care homes to qualify as Medicaid, home, and community-based settings. Among other things, it requires the written discharge notice that residential care homes provide to residents and their legally liable representatives to include contact information for the long-term care ombudsman, and for residents with mental illness or intellectual disability, also include the contact information for Disability Rights Connecticut. Again, putting them in touch once discharged with appropriate support organizations. Secondly, requires residential care homes to provide residents with a discharge plan for alternate residency within 7 days after issuing their discharge notice, and in the case of appeal, submit it to DPH on or before the required hearing date. In other words, a discharge plan is critical. It needs to be timely and it needs to be agreed upon. 3, requires DPH to make a determination on such a request for an immediate emergency transfer within 20 days after the hearing. And our current law does not specify, so we're saying 20 days to fit in with the likely timetable. Requires DPH to send a copy of the emergency discharge determination to the resident or their legally liable representative and the long-term care ombudsman. Requires DPH, if it determines an emergency discharge is not warranted, to proceed with a hearing under the regular involuntary discharge process. And lastly, allows a residential care home or a resident aggrieved by a DPH decision to appeal to the Superior Court, and requires the court to consider the appeal a privileged case. Straightforward stuff that hopefully will help people who have been in residential care homes. Comments or questions? Okay, I guess we agree it's pretty straightforward. Any other timely suggestions on this bill? No.
Mr. Chairman, I recommend we put this on the consent calendar.
Representative Carpino, I believe, would like to suggest otherwise.
I do, sir. I think just, again, I support this bill and I think many members do, but because people are in so many places right now at once that it would be better to do a roll call.
As you wish. Madam Administrator, let's do a roll call.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner, Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong,
Senator Huang votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger-Givallo,
Berger-Givallo votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Representative Elliott votes yes.
Representative Foster, Representative Django, Representative Green,
Representative Green votes yes.
Senator Haskell,
Thank you, Senator Berthel.
Senator Haskell
I just
votes
wanted to
yes.
add,
Representative Cavers DeGraw,
Cavers DeGraw votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Clarice Detrier,
Representative Clarice Detrier votes yes.
Representative Linehan,
Representative Linehan votes yes.
Representative McCarthy, Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Tersiak,
Representative Tursiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Kushner, Representative Dauphiné, Representative Foster, Representative Django,
Representative Jenga votes yes.
Representative McCarthy, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. Once again, 6:30, votes open. Next up is item 7 on today's agenda, House Bill 5001, an act concerning children's mental health. This is a JFS to the floor. Do I have a motion? Moved by Representative Young, seconded by Representative Carpino. Good bill, ought to pass. We ready for the consent calendar? Just kidding. I feel compelled to start off with a little bit of an exegesis on this bill. I think everyone can agree across the state of Connecticut that if there was any group disadvantaged by the pandemic, it was our children. Many of which had plenty of stress in their life before everything that the pandemic required put them in very difficult circumstances. It created a lot of heartbreak in families, but what we're focused on today is the fact that it actually exacerbated incipient or created mental health and behavioral health issues for so many of our kids. And we've got to do something about it. We have to do something about it now. And to the credit of this legislature and the governor, this has been made one of the highest priorities for this legislative session. And it has spawned just a amazing effort by a lot of different people from all 4 caucuses to seek to address this problem. The only good news in the entire circumstance is that because of the ARPA funds, perhaps we can address some of these longstanding problems. Pilot programs to see if they're worthy for scaling up down the road and make a real difference in the lives of so many families across the state. This bill, House Bill 5001, is perhaps the single most prominent of those bills, but I will make mention of SB 2, which also covers many of these issues, and we've already passed out of committee. SB 1, other bills, including bills in this committee that deal with telehealth and recruitment and retention and reciprocity, all intended to try to make a comprehensive effort to reduce the problems of mental and behavioral health in our population. I would be remiss if I didn't add that this bill may be named an act concerning children's mental health, but in actuality, it goes further than that. It addresses issues of adult mental health. It addresses issues that we've discussed of workforce, making sure there are adequate providers with particular attention to children mental health providers, but also more broadly. And it deals with many of the gaps in our healthcare safety net. It is really an ambitious, prodigious effort to do what we feel needs to be done. And as we've said previously, and we will say many times today, many of the programs, grants, loan forgiveness, all these different elements is predicated on sufficient funding from the state of Connecticut. The governor has already professed his desire to see what we can do on this, as have all four chambers leadership. The Appropriations Committee has given this tremendous focus as well. But all the things we're talking about may or may not happen in the way that we intend, unless we're prepared to make that financial commitment, both in the short term, but also in the long term, particularly as it relates to reimbursements and the continuation, creating some measure of reliability and certainty in the system for those who depend on it. It is a huge task. What we have before us is JFS language, but I'm telling you, it's changing almost every day. I've been blessed to be part of this process. I say blessed because there were times it didn't really feel that way because we put so much time in. But we recognize that we still have a ways to go on some of these sections. They need further specificity. And as I said, once we get it to a point where we think it's mostly baked, we still have to have these conversations and negotiations with the funding mechanism. And I'll also add that there's a added complication of making sure all these different pieces of legislation fit together, are not redundant, are not contradictory, and really don't leave any gaps between them all. Now, I contemplated reading to you the meaning of every section of this 80+ section, hundreds of pages bill, but decided that the sound of the snoring after a few hours would probably not be to our benefit. Plus, I'd probably lose my voice along the way. However, I would like, for the benefit of the public, to at least highlight some of the things that are in this bill to give everyone an understanding about just how really impressively consequential this bill can be for the state of Connecticut. We mentioned license reciprocity for mental and behavioral health professionals. There's a grant for tutoring and preparation and prep work for those who are going to take the exam for licensed medical social workers, marriage and family counselors, and the like. In other words, facilitating the progression of people who are committed to this industry and helping them get the educational and experiential requirements that they need in order to practice. We're going to have a scholarship for license fees for those who need it. It expands the Access Mental Health Care Program to provide 3 follow-up telehealth visits. We're recognizing that telehealth is particularly valuable and appropriate for many of those with mental and behavioral health problems, and to allow them to do follow-up appointments via telehealth is an important step forward. Importantly, it extends many of the temporary mental behavioral health telehealth opportunities that we created during the pandemic, and extends them and makes some of them permanent. It creates in the schools the role of a student mental health specialist, which will be charged with coordinating some of these mental health activities and assuring that each school has adequate representation. It will create a grant for youth camps and summer programs, because we recognize that when kids aren't in school, oftentimes these programs where we might have the best opportunity to identify and prevent mental health issues. We also provide a grant for higher education so that we can be assured on our campuses of higher learning that there'll be mental and behavioral health services. We are making sure that all the mental health options available are presented to families when their children are in the ER, so that when they get out of the emergency circumstance, they can be connected with appropriate services. We're dealing with truancy in the school, recognizing that truancy is often a symptom of underlying problems with the family and potential mental and behavioral health. And then making sure that the kids who are truant can get a mental behavioral health evaluation. We're requiring the RESCs, our regional educational service centers, to hire regional trauma coordinators, so that across the state we can be assured that there are people who are prepared to help in this way. We're trying to make sure that not everybody who presents a mental behavioral health episode is directed to the police, but instead perhaps will be directed to other services, and also making sure we fund our 988 suicide prevention hotline, which can be the first line of defense to take care of people who are stressed. We are waiving until 2026 the need for a certificate of need to increase the number of mental health beds in a facility. And the Office of Health Strategy is charged to consider an expedited mental behavioral health CON. We have a grant to help people obtain the necessary drugs or intensive treatments, the ICAPs and the IOP programs, which we know can be a critical bridge from intensive acute circumstances to prospering at home. We create a mental behavioral health screening tool to help during pediatric visits so that pediatricians can make a quick assessment if there are issues with mental behavioral health. We are hopefully funding peer-to-peer support programs, which we recognize are very important. We are hoping to fund a respite program for families who have been enduring long-term issues and giving them a break. We are looking at expanding the CHESLA loan forgiveness program. We are looking at recruitment and retention of child psychiatrists. We are looking to have insurance cover up to 2 mental wellness visits so that without a diagnosis, we can help children get some initial service from mental health providers that may lead to them going down the right path. We're extending loan forgiveness for psychiatric PhDs and doctorate programs. We are suggesting that ambulances divert to new urgent care centers that have been created that offer mental behavioral health services as appropriate. We're requiring insurance cover the collaborative care model, which intends to bring together primary care providers and specialists in mental behavioral health in an integrated fashion that is a model that is working well in a number of places. A bunch of these sections deal with mental behavioral health parity so that we compensate providers at the same level we do for physical health. We have a section on youth services, a youth services core program. We have information that we're asking the police and EMS to spread as the situation presents. We're funding the EMPS mobile psychiatric program, proven to be very effective to be on the spot. We are funding IOP, PHP, PRTF beds, which, as I said, are part of the continuum. We are funding psychology residency and fellowships. And we are directing the Children's Medical Center program to help pediatricians handle the issues they face with mental behavioral health. And that's not even a comprehensive list of everything that's in this bill. But I think you can sense, taken in the aggregate, presuming adequate funding, that this will have a huge impact on the status of mental and behavioral health here in the state of Connecticut. And I hope when this bill eventually passes out of this legislature and is signed by the governor, this will be something we're all tremendously proud of and will be a stake in the ground saying we are committed to taking care of mental health in the state of Connecticut. And I'm glad to answer questions, which I'm sure exist. Senator Wong, followed by Representative Linehan.
Thank you, Mr. Chair, and indeed compliments and kudos to all the members on a bipartisan basis who have worked on this very, very important bill. And you use some key words that is appropriate for this bill. It is indeed quite comprehensive, and it is a huge undertaking. That being said, I think it's been well documented that our youth mental health have struggled during this COVID pandemic, with our emergencies overrun, with challenges in regards to isolation and psychosocial dynamics being disrupted. But it is also important to note that challenges in youth mental health and adult mental health have always existed before the pandemic, and that COVID perhaps may have exacerbated and widened the gulf and raised greater awareness. But I'm really grateful we are undertaking this. But that being said, I'm hopeful. I'm really hopeful that as we look to move to a new stage of hopefully a endemic rather than a pandemic, and that we're going back to a new normalization in our schools and the unmasking of our children to be able to enjoy the social and psychological dynamics of a school interaction, that we can make a small dent beyond policy but the normal dynamics that these children have had to endure along with their parents and families. I do have some questions in regards to this very, very large bill. It's fascinating. The substitute language addressed some certain factors. Could the good chair kind of elaborate in noticing the substitute language? That section 2 was very heavily redacted and removed. Could you share for the for legislative intent what some of the rationales that led to section 2 being heavily redacted and impacted?
Well, Senator, rarely do I respond to such a reasonable question with the response, no. This bill has gone through many changes. I'm being facetious. If you could refresh my memory on what the former version, since there have been so many versions of section 2 was, so that I can more adequately and seriously address your question.
No, fair enough. Fair enough, Mr. Chair. And just for my edification,
Representative Green could please mute her.
thank you.
I'm sorry.
Sorry. Welcome to the Zoom world. Fair enough with your response, Mr. Chair. Just for a clarification, we are looking at substitute language LCO number 4047. Is that correct, sir?
That is correct. And again, my insufficient answer is a direct result of having seen so many versions of this bill that only an LCO number would allow me to be able to tell you which ones we're looking at. So that is correct. That is the latest version, but I submit it will not be the final version.
And out of respect for the time and the long day we've had already, I'll rescind my question and just simply offer the fact that this is a bill that's going to have widespread bipartisan rapport, but a bill that's over 100+ pages, that moved from 76 sections to 80 sections with a fiscal note that we have not yet fully comprehended. But also, I encourage for us to be cautious in the weight of this bill. The challenge of trying to do something so comprehensive, so expansive, it is a caution that I would give that we may not be able to do everything well. We do everything a little bit better. Rather than focusing in on some smaller, narrow areas where we can make a comprehensive analysis. That is one of the words of caution I raise on this bill. The other part is that we need to consider an entire ecosystem. And I know the proponents of this bill and the hard work by the advocates address many components of it, but I do believe there has to be an insurance component in this area. I think there is a consideration in the meshing of Senate Bill 1 and Senate Bill 2 that perhaps we could all look to work together and create one bill and target on areas that we can address the issue of mental health comprehensively and not just simply look at the children aspect. So I will be supportive of this bill moving forward, but I want to also publicly state the caution that we need to proceed of trying to do too much at too short of a time, and we perhaps end up not doing anything well. So thank you very much, Mr. Chair, and I want to again close by applauding the great yeoman effort of all the colleagues, and truly in the early onset of this bill, a true bipartisan effort that I hope will continue. Thank you, Mr. Chair, for the time.
Thank you, Senator. Yes, I agree with you. We enter into this task knowing full well that there's a risk in trying to get so many different moving parts working in unison to accomplish our good intentions. I would not recommend people at home try to do something like this. This is something we only do once in a big while and only when we have really good reason to do so. It's such a serious undertaking. I think all of us involved are appropriately chastened and cautioned that we would not want to do this again real soon. But the circumstances, the urgency merit this kind of attention. And to your point about the money, yeah, we're all prepared for blanching from the sticker shock of seeing what the Office of Fiscal Analysis will tell us all of this will cost. And then we're going to have very serious negotiations on what we can actually afford as a state. That is still in front of us. I'm about to hand it off to Representative Linehan.
Well, if I may follow up on that, Mr. Chair, I think we have had the luxury of federal ARPA funds supplementing the challenges that we've had during COVID. But I think another important element when we look at the funding is the sustainability, the maintenance of these programs, that with an influx of money that fixes the problem on a short term, and our inability to plan for sustainability, to plan for a viability of funding mechanisms to create programs that will last not only 2 years, 3 years, but 10, 15, 20, and make a comprehensive change into the system is another note of caution that I have, is that it is important that we look at this package, that we are in a unusual fiscal note in this state's history. But nevertheless, I hate to go into such an important issue with a feast and famine fiscal policy on this. We need to look at sustainability. We need to look at this bill from a comprehensive, holistic approach of saying what is going to be viable 5, 10, 15, 20 years as a comprehensive program. So I appreciate your thoughts in regards to that as well. And I appreciate the opportunity to extend the conversation a little bit more with you beyond that. Thank you.
Thank you, Senator. Yeah, all of us who have been involved with this process are extremely cognizant of the long-term ramifications of making commitments. As you might imagine, a lot of providers in the state of Connecticut have approached those working on this bill to be included, to have their extremely worthy programs funded, to address lack of COLA increases, lack of adequate funding, inadequate reimbursements for the services they provide. And we'd love to help everybody because, as I said, virtually all of them are worthy. We know we're going to disappoint some people, and that even though the state may appear to be flush right now, it is a bit of a chimera, that it is only temporary. We still have some underlying systemic fiscal issues relating to our pension debt that make it very difficult for us to make long-term commitments. In fact, it's that fiscal circumstance that have led us to many of the problems we're now facing because of our inability to actually fund programs we know are both effective and are often the only option for people who are vulnerable and in need. So, I hate to think we're going to be disappointing a lot of folks, but I know we will be disappointing some. And that's really one of our next stages. As I was saying, I'm going to hand it off to Representative Linehan, but I'd be remiss if I did not acknowledge Representative Linehan for being a primary leader in the entire effort here. Her passion and her knowledge of the various subjects that we've discussed is really amazing. She has been an amazing partner along with Representative Exum, Representative Pettit, ranking member on this committee, and Representative Nuccio and others. And I also want to recognize our amazing lawyers, both our LCO lawyers and David Desjardins, who has been our point person on this. You would not believe the number of hours that have already been expended on this task and will be expended before the bill reaches the floor. But I want to hand it off to Representative Linehan and express my appreciation for all of her hard work. And I'm sure she has some very cogent comments to add as well.
Thank you very much, Mr. Chairman. Thank you for those kind words. And I echo your thoughts, thanking everyone involved. It really has been a collaborative bipartisan effort. And I can't thank everyone enough for not only giving us your time and energy, but also your passion and commitment. But I did want to take a minute to talk to Senator Huang, who did mention some things that we have, as you said, Mr. Chairman, we've been very cognizant about, and that is the fact that these things that we put forth have to be sustainable. And so I'd like to let it be known publicly, and perhaps maybe even for the first time, that we are looking at this legislation as a short-term, intermediate, and long-term intervention for the state's mental health system. And so the way that we're doing that is ARPA funds. We're looking at ARPA funds for the short term, for the stabilization. Senator Wong was correct in saying that, in fact, the mental health system, especially the children's mental health system, has certainly needed a lot more help even before COVID, and that COVID has exacerbated the problems. And that is exactly the case. So we believe that that funding some of these programs through ARPA dollars is the way to stabilize the system. And it's appropriate given the fact that it was exacerbated through COVID. And then all of the things that we're putting forward through the ARPA funds require data to come back to the legislature. So we can look to see, number one, is this sustainable for the long term? And if we do believe it's sustainable, is it really meeting the guidelines that we set forth, that this is actually something that's going to make a difference in our kids moving forward? We recognize ultimately that there is a need to stabilize, and then moving forward, there would be a different set of priorities. We talk a lot about the lack of available beds. And yes, that is an important thing to note. However, by funding the things in this bill that we talk about for the intensive outpatient programs and the partial hospitalization programs, having more mental health professionals in schools, having outreach go to kids' houses through their school system, if that is something that that their school districts think is beneficial. Those are the things that actually will help keep our kids out of the hospitals, out of the emergency rooms, and hopefully out of inpatient care. So we are looking at this, like I said, short-term, intermediate, and long-term. Something I really want to focus on as well is that, first of all, thank you to the speaker for making me one of his designees on this bill, along with Representative Exum. It should be noted that Representative Exum and I have been working on this for a long time, even prior to when the working groups got together in October. And the Children's Committee, for which I co-chair with Senator Anwar, we've been working on these issues for years. So this is a culmination of all of those things. So we recognize also that the things that we're putting in this bill, just as our fine chair had said, we probably won't be able to do them all. But it was important that we put them all in this bill that is getting out of committee today to show that these are all our priorities. Once we get the fiscal note back, we will then be able to have that very difficult discussion and prioritize further to decide what we're going to move forward with. But I can say with every fiber of my being that this is the most comprehensive children's mental health and adult mental health bill that has been put forward in this legislature ever. Connecticut Children's has stated that this is a transformative piece of legislation and that they think it's going to make the biggest actionable difference that they've ever seen. So I will be available if there are any particular questions that Mr. Chairman feels should be thrown to me. However, Mr. Chairman, I think you did a wonderful job going through many of the subjects, but I would also like to reiterate, Mr. Chairman, what you had said. Thank you to everyone who's put in a lot of work. Representative Exum, as well as you, Jonathan, thank you very much. To our ranking member of this committee, Representative Pennant, Representative Nuccio, and then we have a whole bunch of others who are on working groups beyond that, who put their thought, commitment, and passion into this legislation. And I'm going to be thrilled when I see this come to fruition, but please know that there will be further conversation. And that doesn't just mean further conversation within our working group, it means further conversation with every member of the legislature who is interested in continuing the fine work that we're doing here to really create the most wonderful, bipartisan, transformative piece of legislation for children's mental health that we've seen. So with that, thank you. I'll send it back to you, Mr. Chairman, but I appreciate everybody's support today.
Thank you, Representative. And I agree with you that we're open to additional conversations, but I will add that if you want to have those conversations, we'd appreciate you have them soon, because we'd like to get this bill ready to go, get that fiscal note, shape it up for a vote on the floor. And to your point, to answer Senator Wong's concern about trying to do too much too fast, this has been under consideration for well over a year. Some of these elements are part of bills that we've considered in the past, but particularly efforts by Representative Linehan and Representative Exum going back well before the start of this session gives me confidence that our approach is going to be the appropriate, effective way to deal with a lot of these issues, and that they're very well thought through, even if we continue to work on the language. And I should specifically thank our LCO, Eileen Lawler Parker, because I describe her sometimes as long suffering, because this committee is challenging in terms of the number of things we take on. I imagine members of this committee would agree with that statement. But this bill has been a particularly challenging one in that it has gone through so many changes and it's breaking so much ground. And Eileen deals with us all with an equanimity that I don't think I could muster. And we'll thank everybody again next week. But this bill is a signature bill for the legislature, but it is also a testament to the work of our LCO lawyers, who are amazing, who take these sometimes not well conceived or articulated thoughts and turn them into law. And if this bill succeeds, it will be because of her and others' efforts along those lines. All right, let's move on to Representative Cabros de Graaf, followed by Representative Foster.
Thank you, Mr. Chairman. I was thinking about some of the comments that were made, and especially about where we find ourselves, because while we are at a crisis point, and the pandemic certainly illuminated that, there are many of us who have experienced this personally over the course of the last decade. And honestly, this was and all of these mental health issues were probably more than a decade in the making. However, I would say that the societal change that our children have seen in the last decade has exacerbated many of the issues. And then the pandemic certainly brought those to light. I never imagined when we were going through this in my own family that I would actually be sitting in a position where I would have the ability to affect this law. And I am so grateful and proud of the working group, and specifically Representative Exum and Representative Linehan for their work on this, as well as many others, because there are so many children that have already been missed for mental health that are not with us. And I do appreciate that this bill not only is addressing children, but adults as well, because we need to make sure that while we are building this future society by taking care of our children's mental health, that we are at the same time addressing the immediacy of the crisis which we face, and that is with adults as well as children. I think that when we talk about the funding, and thank goodness we do have the ARPA funds, we have to be very cognizant as we move forward that this crisis will not end today, it will not end tomorrow, it will not end when we pass this legislation, and it will not end with what is in this legislation unless we are committed moving forward to providing the funds and providing the supports for the society in which we live, because so many of our ills can be traced back to all of these mental health challenges that so many people are facing. So I am proud to be here today, and I am just so grateful, and I hope that we are all committed moving forward to think about, in terms of appropriations and in terms of funding and our budgets, to continue the good work that has been started by this working group as we move into the future, because that's what's required of us. Thank you.
Thank you, Representative. And again, to reiterate that very good point, the title may be Children's Mental Health, but we've had access and quality issues for mental behavioral health in the state, which span the entire age spectrum. And this bill does make significant strides to addressing mental health for people of all ages. Representative Foster, followed by Senator Anwar.
Thank you to everyone who's spoken in support of this bill prior. And thank you to Representative Cabros de Graaf for bringing up the children who have been lost prior to enaction of this bill. I thought a lot about this throughout the time, but when I entered college, I lost a very close family friend to suicide. And I think that it's true that there are children who have been missed in this time. But I think, like many of my colleagues, as we've read over this bill, I've thought about every story from every constituent around children's mental health and mental health in general, and what our system was missing. And I have this one book at home where I've written down these mental health stories, knowing this was our priority and our focus this year. And last night, as I was going through the S language, all of the immediate crises that my constituents shared with me in walks around Arbor Park in the center of town in Ellington, where mothers cried with me about the struggles that they faced with their children, and parents told me of the tremendous fear that they had, knowing that the hospital was telling them their situation wasn't emergent enough to stay, and that there was not a next place to go, that so many of what failed these families before is going to be resolved in this bill. And so I just feel like I want folks to know every one of those stories where you laid your heart and soul bare to us, we heard and we grieved and we were sad and scared and frightened with you. And we wanted to find resolution. And I'm so grateful to my colleagues who spearheaded the effort of orchestrating this bill. And thank you to the chairman for bringing it out today. I'm very excited to vote favorably of this bill out of committee. And I hope that we can find ourselves, though I know this is not the case, in a situation where we won't be crying with parents next year in a public hearing over things that, you know, it's 10 years in the making. But I'm glad that we can make this progress today. So thank you to my colleagues for their work on this. And I look forward to voting yes.
Thank you, Representative. Senator Anwar, followed by Representative Zupkis.
Thank you so much, Mr. Chair. I'm honored to serve as the acting chair of the Public Health Committee. I'm also honored to chair the Children's Committee. This bill is a product of these two committees coming together. The important thing is that when you have a crisis, and you have a crisis where some of the most important citizens in our state are going through a challenge, and then you have a responsibility to address that, we can do two things. We can do a Band-Aid treatment, or you can have a comprehensive strategy. What we have collectively done as a state is that we want a comprehensive strategy. We want the year 2022 to be recognized as the year we had a change in the trajectory, where a comprehensive plan was made to take care of all aspects of our children's well-being, including early interventions. First, we need a primary prevention, we needed early intervention, early identification, and then a long-term strategy to make sure that anyone who has a challenge can be taken care of. This bill is part of that strategy, and it is a heroic work with everyone involved at all levels. This is something that we can all take pride that we were involved in this, and we were involved in trying to address this. And then hopefully, once we invest in this aspect, we are going to be able to look back and smile and say that in 2022, we addressed this problem, and as a state, as legislature, we made a difference. I know, well, as far as this committee is concerned, it's easy. I would be somewhat shocked if any one of the legislators would vote against something that is so important and so critical. I would actually ask each and every one of us to use all resources to work collaboratively to make sure that some of these bills that are going to come forward on the children's well-being, we work with appropriations with the governor's office to make sure that we have appropriate resources. If we do not invest in all of these aspects, we will be back here having this conversation again. And I feel that all the people who have been here for a long time, we have this conversation every 4 or 5 years. And this time we have an opportunity to not have to have this conversation if we do this in a comprehensive manner as it has been done. I have to mention Representative Liz Linehan, who breathes this as well. And I cannot thank her enough for the work that she does. And then again, Mr. Co-Chair, the work that you have done in the last many months on this has been amazing. This actually started many months ago, even before the session. And that's what we have all been involved in. It started with the Children's Committee public hearing that we had, actually an informational hearing that we had with getting all stakeholders together. And this journey has brought us this far, but we have a long way to go and make sure this gets implemented. And I'm just honored to be part of this entire process, that we are all living together and making sure that our next generations are protected. Thank you so much.
Thank you, Senator, and thank you for, as chair, straddling the two committees here like a colossus in order to make sure we've got it all covered in both committees. Representative Zupkis, followed by Representative Berger-Travallo.
Thank you, Mr. Chair, and I too appreciate all the work that's been done on this. It is obvious that our kids are our most important possession, and it is troubling that there is so much mental health amongst them. And I do not believe this just happened during COVID. I believe COVID exacerbated it, as has been stated. And I know that things have been done in the past. So I truly hope that this bill will get to the root of the problem. And I guess that's my question for you, Mr. Chair. Will this bill get to the root of the problem and fix the problem and the cause? I know there are many different causes, but really get to the root of this issue.
That's a really complicated question, Representative. Fix sounds definitive and final. And I think that this, for all that it purports to do, for all our intentions, for all the money we will put against it, is not either a guarantee nor likely to address everything. And we will learn from this experience. We will use ARPA funds to pilot, to test out programs, to see which ones work and which don't, and then seek to scale those up and get them regular funding from the budget. And we will learn about other things. We will see what other states do. We will see how things play out in Connecticut that may be different than how they play out in other states. This is a journey. This is not a, you know, been there, done that, wash our hands, move on. This is a sign of our commitment to the children of the state of Connecticut to look out for their interests. So I will not use the word fix. I will use the phrasing that this will take us on an appropriate path to do the right things. And we will continue to review this and be committed to it. And I would submit this may be a subject like we have with other subjects, like dealing with the opioid crisis, with suicide prevention, with any number of other topics that continue to plague us here in the state of Connecticut. This will be something we talk about every year. And over time, perhaps you and I can agree that we fixed it, but I'm not prepared to do that in one foul swoop.
Understood, and that was the wrong word to use, but I do hope it gets to the root of the problem, and will help with that. So it becomes less and less over time. That's what I meant. Obviously, there's always going to be, unfortunately, mental health issues and all these other issues, but I hope we can really peel back the onion and get down to the root of this problem, to help more and more people. And I was glad to hear, I am concerned about the fiscal note. I think when we hear what it's going to be, all of us will be floored to hear what the fiscal note is going to be. So I'll be supporting this bill today because it is so important as we're all focused on it. And I hope that once it gets out of committee and the fiscal note gets attached to it, that everybody really takes a look at what will peel back that onion, get to the cause, see what we've been funding. And again, what hasn't been working, because it hasn't been. And so I really hope that analysts will be done and move on to really a great piece of legislation for the future of our children. Thank you.
Thank you for those sentiments, Representative. And to your point, as has been mentioned previously, the work on this bill started well before session. And for some, this has been their passion for a number of years. And I have failed to give sufficient credit to the many people we've engaged who have been feet on the ground, who are running these programs, people who have experienced some of the gaps in our healthcare service portfolio. They have been part of this process too. And to your point, once this bill gets out of committee, we get the fiscal note and we're forced to make some really hard decisions about how to go forward. I think we're going to be dealing with the natural tension between trying to be all things to all people and take care of everybody, and making the harder choices of not funding everybody and trying to make sure we move the needle, that we make a difference with the programs we are supporting. And that's the tough decisions we have in front of us. And I can assure you that we will be engaging not only members of this legislature, but again, those same people who brought us to this point, who informed much of this legislation, so that they understand and can hopefully get behind the choices we will have to make. So I think we share the same hopes for this legislation, the same sober realization of what lies before us before we get a bill we can vote on. Representative Berger Travallo.
Thank you, Mr. Chair. So much of what I wanted to say has been said by my colleagues from both sides of the aisle. But I think as we all talk to parents in our own communities, as we listen to them in the hearings, and just hear over and over and over how we know that these problems have existed long before COVID. And the collective cry is now is exactly the time to start to, now is exactly past time to start dealing with it. But now that we have these tools and we have this incredible legislation in front of us, it's time to find a solution. And the beauty of hearing these parents, these families, is you'd have to go to their registrar of voters to find out what their voter registration was. This is not a Democrat thing. This is not a Republican thing. This is an everybody thing. And anyone who cares even a little bit about the mental health and well-being of children and everyone else who is addressed in this bill can agree that this is something that rightly so has been accomplished collaboratively. And I'm very proud of that. And I'm so impressed by those who have done this incredible work. So obviously I'm telling you, I'll be supporting this. Thank you, Mr. Chair.
I was drawing that conclusion, Representative. I will also add to Representative Zupkis's comments about making sure we know that these things are being effective. I kind of glossed over a lot of sections of the bill that deal with the kind of oversight we intend. And many of these steps require assessments, analyses, and reports to come back to this committee, to the Department of Public Health, to the Department of Education, depending upon what we're talking about. There's an expectation that we will not merely put these things out there and wash our hands of it, but that we expect to be able to evaluate the effectiveness. And that will help us determine which of these programs, which of these grants, which of these loans we both continue on for the long term and might choose to invest even more in should we have available appropriations. I don't see any other comments. I understand that we still need to do a roll call vote. So, Madam Administrator.
Representative Steinberg,
Representative Steinberg enthusiastically votes yes, and I don't usually comment.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner, Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong,
Senator Tony Huang votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Burgos-Givallo,
Representative Burgos-Givallo votes yes.
Representative Carpino,
Representative Christy Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster,
Representative Foster votes yes.
Representative Django, Representative Green,
Representative Green votes yes.
Senator Haskell,
Senator Haskell votes yes.
Representative Cavus DeGraw,
Cavros DeGraw votes yes with enthusiasm.
Representative Kennedy,
Representative Kennedy votes yes.
Representative Clarice Detrier,
Representative Claire Distria votes yes.
Representative Linehan,
Representative Linehan is grateful and votes yes.
Representative McCarthy, Senator Moore,
Senator Moore is grateful and votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Tersiak,
Representative Tursiak votes yes.
Representative Young,
Representative Young votes yes.
I did not see you, Representative Young. I'm sorry.
Representative Young votes yes.
Thank you. Representative Zupkis,
Representative Zupkis votes yes.
Senator Kushner, Representative Dauphiné, Representative Elliott, Representative Django, Representative McCarthy, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. Again, to all my colleagues, get those votes in by 6:30. Operators are standing by. Item 8 on today's agenda, House Bill 5261, an act increasing access to reproductive health care. This is a JFS. Do I have a motion?
So moved.
Moved by Representative Gilchrist, seconded by Representative Young. This bill is very straightforward. Currently, in the state of Connecticut, only a physician may perform aspiration abortions. This bill allows PAs, APRNs, and nurse midwives to perform both medication and aspiration abortions. And to be clear, PAs and I guess nurse midwives need to be performing their duties within an appropriate facility, and PAs must do so as other aspects of their scope of practice under the supervision of a physician. So to be absolutely clear, what we are proposing here, from what we understand from the Department of Public Health, is within the scope of each of these practitioners. And all we are doing is expanding those who can provide these services to include those who have appropriate scope of practice. I see we have some comments and questions, not surprisingly. Senator Anwar, followed by Representative Gilchrist.
Thank you, Mr. Chair. If there's no objection, can we put this on consent calendar, please?
I do believe.
Yeah.
Some
No, sir.
But nice try.
Thank you.
Okay, is that it? Okay. We got to keep it light this afternoon. Okay, Representative Gilchrist, followed by Representative Carpino.
Thank you, Mr. Chair. So as we see what's happening across this country, the attacks on reproductive health care, I just want to thank those who came before us in the state of Connecticut for having the foresight to codify Roe v. Wade in Connecticut state law. Since that time, though, our state law has become antiquated. And so, as you mentioned, the legislation before us is updating Connecticut's current statute. So what the bill will do is codify a 2001 Attorney General decision, which allows APRNs, nurse midwives, and PAs to perform medication abortion. Additionally, as you mentioned, this bill will come in line with 14 other states in allowing those same provider types to perform aspiration abortion. And in doing so, we are actually, current state law is what is prohibiting those provider types from performing aspiration abortion, because under their current scope of practice, they would be permitted to do aspiration abortion were it not for our current state law that allows physician only. And so just to elaborate on the scope of practice, APRNs have to be in collaboration with a physician, a PA has to have the supervision of a physician, and a nurse midwife has to work in a healthcare setting. To me, though, the bigger piece is why. Why do we need this at this point in time? And so this policy is about ensuring that individuals in the state of Connecticut have access to abortion care. And we heard during the public hearing that when an individual is seeking aspiration abortion in the state of Connecticut, they sometimes have to wait up to 2 weeks, which is just not acceptable. When someone has made the decision that they want to have an abortion, they should be able to get that abortion as soon as possible, which is best practice. Additionally, during the public hearing, we heard about continuity of care. So when an individual has seen their PA for years or has seen their APRN for years and then needs an abortion, they shouldn't have to go to a separate facility. Abortion is healthcare. And so this policy is ensuring that individuals in the state of Connecticut can get that continuity of care. And so I will be supporting this policy today. Thank you so much, Mr. Chair.
Thank you, Representative. Just before I hand it off to Representative Carpino, I want to make sure I was clear. APRNs, PAs, and nurse midwives can perform medical abortions, and that's what we're here to talk about today, in case I was not clear. Representative Carpino.
Thank you, sir. Could you just explain an aspiration abortion for me, please?
Wow, this is twice in one day. The answer might be no. Please, well, that makes all the difference. Thank you. I am not an expert in that specific subject. Perhaps if you'd like, I could direct it to Senator Anwar, who might have a bit more expertise than me.
I defer to you, sir. If he's better qualified, I understand.
Virtually anybody is better qualified than I am. Senator Anwar, if you mind taking that on?
Actually, Mr. Chair, I think the top proponent of the bill would be better equipped. Our Vice Chair, Representative Gilchrist, could explain that. I'll tell you in simplistic terms, it's a very simple procedure, which does not carry the risk. It's not a surgical intervention like we are sometimes concerned about. This is actually a simpler procedure, much simpler than a DNC, and the complication risks are much less than a DNC. And then that's why it's allowed in many of the other states to be performed by physician assistants under supervision, as well as the APRNs. And the American OBGYN, American College of OBGYN allows training, and then they have a curriculum that allows the individual to be able to safely perform the procedure. So because there is not direct cutting involved or surgical intervention, it is more of a procedure than a surgery. That's how I understand this, Mr. Chair.
Thank you, Senator. If the good representative would like, I could ask Representative Gilchrist to amplify further.
I have a question more specifically, and I respect you to defer to whoever is best able to answer this. Is this what is known as a suction procedure to terminate the pregnancy, sir?
Representative Gilchrist, would you like to respond to that?
Yes, I'm happy to, Mr. Chair. Through you, an aspiration abortion is sometimes called a suction abortion, and it can be used until about 14 to 16 weeks after your last period.
Representative Carpino, does that answer your question?
It does, sir, and I appreciate that. I was fortunate that both of my pregnancies ended with the birth of my children, so I just wanted to make sure that I was accurate in what I was talking about. I just have a comment. I believe in a woman's right to choose. And I am fortunate that I live here in the state of Connecticut, where that issue has been decided long before I came to the General Assembly. And I believe that is an important right for our women today and tomorrow. However, I'm not comfortable with this procedure being done by anyone under a physician. And I don't want my no vote to be misconstrued or be misrepresented by anyone. I am not comfortable with this. I respect those who see it differently. However, having conversations with both medical providers and women who had different outcomes with their pregnancies, I'm sure that my vote will upset some. I'm sure my vote will make others happy. I just hope that my vote is respected by both sides, because this is a very emotional issue for some. So thank you, all three of you, for trying to answer my question. And I appreciate your time, sir.
Thank you, Representative, for your candor. I, for one, respect your choice, because this is related to choice. Senator Kushner, followed by Representative Berger-Gervallo.
Thank you, Mr. Chair. I just want to say that I actually have been seeing a PA in a medical practice for the last 10 years. When I found I needed to go to a cardiologist, and luckily I'm fine, but it was discovered by my PA. I go to this PA I haven't seen a doctor in that practice in the last 10 years. I have total confidence and trust in her and her ability. And I have to say, if I were a young woman in a position where I chose to have an abortion, I would much prefer to go to see my PA. If she chose to perform abortions, I would be much more comfortable seeing her than going to someone I didn't know. And I feel like that's what I think is at the core of this, is making sure that both there's availability, but there's also the people that you trust to perform your healthcare, to take care of you as you would with any other illness that I might have. You know, I do know from personal experience, I'm a mom of 3 and a grandma of 4, and I adore my family. But I did have different outcomes when I was younger, and I would have much preferred to be able to be in a situation with a PA if I was having an abortion than if it was my healthcare provider. That's what I'm saying. It doesn't matter if it's a PA or if it's an APRN or if it's a doctor. To me, it was like having that ability to go to someone that I trusted, that I knew would take good care of me. So I really hope that people will consider this. It's about
given that we just received it, and
it's about healthcare. It's about having all the options to see the provider of your choice. And I really hope that people will understand this. And, you know, for that reason, I'll be voting yes. Thank you.
Thank you, Senator, for sharing your personal story. I imagine many people either have such a story or know somebody who's close to them who has such a story. And I think you also described some of the changes that are going on in healthcare, is that direct care and quality direct care is often provided by somebody other than the physician these days. And those who have done the requisite training and are trusted by the physician in their practice to take on this task should be entitled to do so. Representative Berger Travallo, followed by Senator Wong.
Thank you, Mr. Chair. This is never a particularly easy subject for me to talk about, even though I am and have always been in support of choice and was before I sought my abortion at 19 years old. I am the mother of 2 beautiful children, and I am so glad that I have those children. That is the most humongous understatement that I'll ever make. But I would say that if I had had this option when I, at 19, with my children's father, found myself with a pregnancy we were not ready to handle, if I had had an option where I didn't have to go into a clinic with protesters who were grabbing at me and with a stranger and in a room full of other strangers who administered what is known to be one of the safest medical procedures that we have available. My anxiety was not about that procedure. My anxiety was about all of the people in the room who I didn't know. My anxiety also came from the stigma and not being able to talk about what it was that I was doing and why I was not going to be attending my best friend's party that night, and why I was in bed again the next day and didn't want to let anybody know. There's all kinds of stigma there. And that causes some of that anxiety and fear. But I know that much of that could have been alleviated if I had been with my own gynecologist, if I had been able to be in a practice that I was comfortable, one that my partner at the time would have been able to come into a room with me for. This will help those who are seeking abortion for whatever reason they choose to do this for, to find a place that is comfortable. It will increase access, which we've discussed, which is greatly needed. Waiting 2 weeks for this, which I did actually have to do. And this is, I did say I was 19. I'm not going to tell you how many years ago this was because I'm not going to give you that math. But that was even back then, to wait another 2 weeks was agony and also pushing me into a much more physically vulnerable place. Never mind emotionally vulnerable. obviously, I'm going to be supporting this, but I would ask that if you're even remotely on the fence about this, remember these two things. It is one of the safest medical procedures you can have, and the comfort of care with someone you trust is a critical part to being able to heal after whatever decision you make for yourself. Thank you very much, Mr. Chair, and thank you very much, Rep. Gilchrist, for all the work that you've done on this.
Thank you, Representative Berger-Giavallo. I imagine it can't be easy sharing one's personal story, particularly at a time which must have been a great stress for you, being a very young person faced with such a difficult decision. I will say that in the bad old days, before Roe v. Wade, there were even worse stories of what young women were forced to choose to do. Not safe, extremely dangerous, potentially lethal. And I'll just say it grieves me that the Supreme Court of this country is threatening to upend decades of legal precedent and ignore the express preference of the vast majority of the people in this country to take us back to the bad old days. And I hope that never happens, and it will never happen, I believe, in the state of Connecticut. Representative Wong.
Thank you, Mr. Chair. And it is tough to follow you, Representative Berger-Giavallo, and thank you very much for sharing your personal story. You have done that a number of times in our legislative dialogues, and it has always been very touching and respectful. So I wanted to thank you for that. I do fully support a woman's right to bodily choice and autonomy. And just as I've fully supported vaccination choices, and to that end, I'm continually frustrated by some of our policy dictates in the General Assembly is we pick and choose. So with that as an aside, I would simply ask, before I discuss, I would ask for our colleagues to respect the deeply held choices of our colleagues who may have differences of opinion, and not make light of our votes and our approaches to this important dialogue. For me, it has always been about a woman's right to choose. That being said, as we have discussed in many of our previous bills, that it is the Public Health Committee. And the additional point that I wanted to add as part of the leadership group is we've had many conversations with the Department of Public Health. And in regards to expanding the scope of individuals being able to perform a very important and critical health procedure, we want to be sure that those professionals are capable and safely conduct that medical procedure. I am comfortable with what has been articulated by the Department of Public Health in regards to that expanded task that we are undertaking in consideration in this bill. So as a result of that, one, supporting a woman's right to bodily choice, and also making sure that the procedures and the expansion of some of the individuals being able to perform these important healthcare tasks. I'll be supportive of this bill, but I close again by simply asking that as we deliberate on this debate, that we don't cast aspersion or cast judgment for individuals that may feel very strongly one way or the other. I think it is important to respect that and to engage in a respectful dialogue as we move forward on this discussion. Thank you, Mr. Chair.
Thank you, Senator. Yes, and respect should be the cornerstone of how we treat one another, not just in this legislature, but more broadly. But I'm just going to quibble a little bit with one of your statements. I do not interpret this bill as an expansion of scope of practice. We have the opinion of the Attorney General. We have the words of the Department of Public Health that this is within these practitioners' scope of practice. All we are doing is addressing, one might describe it as an anachronistic anomaly in the statute, which occurs in all sorts of different places when we only allow doctors to do much of anything. And we are recognizing their scope of practice by making a change to the statute, which brings it in conformance with DPH's scope of practice rules. So it's not an expansion in that sense. So we can agree to disagree on the appropriate verb to describe what we're doing here.
And I appreciate that, Mr. Chair, and that's part of the dialogue in me bringing that up and getting that point of clarification. I want to compliment the really good work of yourself, as well as Dr. Anwar, Saud Anwar, and my ranking members, Dr. Pettit. We have medical professionals that are part of the leadership group, in which we've been very lucky to. So I greatly appreciate the clarification, but I think the comfort that I take in this is the fact that we have gotten input, and it's important to note for the record, from the Department of Public Health in that arena of questions. So again, thank you for that clarification, and thank you for the good work of the leadership team.
Thank you, Senator, for all the work you have done as well to defend and promote choice in the state of Connecticut. I don't see any further questions or comments. Madam Administrator, I believe we will have a roll call vote.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes. Did you see me?
yes, I did. Thank you. Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong,
Senator Huang votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger-Givallo,
Representative Berger-Givallo votes yes.
Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Django,
Representative Jenga votes yes.
Representative Green,
Representative Green votes no.
Senator Haskell, Representative Cavers DeGraw,
Cavros DeGraw votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Clarides Detrier,
Representative Clarice Detrier votes yes.
Representative Linehan,
Representative Linehan votes yes.
Representative McCarthy, Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
I did not see you on screen, Representative Parker.
Can you see me now, Beth?
Yes, I see you now.
Representative Parker votes yes.
Thank you.
Thank you.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Representative Dauphiné, Representative Elliott, Senator Haskell, Representative McCarthy, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. Votes open till 6:30. Next up is item 9 on the agenda, House Bill 5272, an act concerning menstrual products. This is JFS. Do I have a motion? Moved by Representative Gilchrist. Do I have a second?
Second.
Seconded by Representative Berger-Javallo. This bill requires school boards to provide free menstrual products in restrooms that are accessible to students in each school under their jurisdiction. It requires public higher education institutions to provide these products in at least one central location on each campus. It requires domestic violence emergency shelters and state-funded homeless shelters to provide these products in each shelter restroom that is accessible to residents. It requires all such schools, higher education institutions, and shelters, as well as the York Correctional Institution, which must provide these products already under existing law, to provide these products in a way that does not stigmatize anyone seeking these products, and to do so under DPH established guidelines, and allows any such entity providing these products to accept donations or grants or partner with a nonprofit or community-based organization in order to provide these products. The bill also updates language in existing statutes, replacing the term feminine hygiene products with menstrual products. I believe Representative Gilchrist has a comment or question.
Thank you, Mr. Chair. It is a comment. I am speaking in strong support of this bill today. To me, it is about equity and addressing stigma. With regards to menstruation, we heard from many individuals who came before us to testify about the shame that they have had to feel and having to go to the nurse's office or not to be able to access menstrual products. And we know that there are individuals who miss school and miss work as a result of not being able to access menstrual products. And so I want to speak to two pieces, one being the cost. I know that that's been raised, and the proponents of this bill do want to give a shout out to our good colleague, Kate Farrar, who has just worked tirelessly on this proposal. The hope is to get this out of committee as is so we can understand the fiscal note. Conversations are being had with the Appropriations Committee as well as with organizations in the state that provide these products free to see if we can create some type of public-private partnership for startup costs. But I will say, and I am fine with this and hopeful we will get to this point, that at some point we would expect schools to include this in their budgets, just like they include toilet paper, because a piece of this, again, is addressing the stigma that has been for far too long associated with menstruation, which is just a normal part of an individual's life. The other piece about that I want to raise is ensuring accessibility to all students, K through 12, and in our colleges. We know that for Black girls in particular, they are experiencing their periods at younger ages. And so that is why we want to ensure that this is available in elementary schools. And then we want to ensure that it is available in both, in all gendered bathrooms, because there are transgender students in this state. And we want to ensure that all students have access to these products. Additionally, I think by having these products in all bathrooms, we can once again address stigma. Boys and girls should be learning about periods, and that will help to alleviate the stigma associated with this. So for all those reasons, I support this bill. Thank you, Mr. Chair.
Thank you, Representative Gilchrist. Representative Zupkis, followed by Senator Anwar.
Thank you, Mr. Chair. And my thoughts really have not changed. I do appreciate Representative Farrar reaching out to me, but my thoughts have not changed since we discussed this in committee or during the public hearing. And, you know, I believe we need to lift our girls up. And we need to encourage them and inspire them to advocate for themselves. And just as I would tell my daughters that if they were at school caught without something, to go to the nurses' stations. All of our schools have tampons, pads, any of these hygiene products or menstrual products in the school nurses' offices. And I believe that we should be encouraging our girls and our leaders of tomorrow to be able to stand up. This is natural, as the representative right before me had said. This is a process that God gave us to bear children, and we should not be ashamed of it, although at times it can be embarrassing. However, I really think that and I know this came from some students when we heard this, I believe it was last year when it first came out from Fairfield County, and a senator who is no longer serving with us. And I thought it was so great that students from Fairfield County could go in, take on a project, learn leadership skills, learn how to raise some money, and do some great things for somebody who may not be as fortunate as they are, to be able to go into these schools in these underserved communities and work with these girls. Those are all great things that our children can learn from. And so I think it's a great idea that they would take this on in nonprofits. I do not support any mandates on the schools. How do they keep those supplies forever? I mean, a girl has it for a very long time. And so it is a mandate and a cost to the schools. And so for those reasons, I will not be supporting this bill. Thank you.
Thank you, Representative. I agree. This is a mandate. And I'm usually a little wary of mandates imposed on the schools, which are often overburdened, and some of our school districts are challenged to meet the needs of their students. But I am prepared to make an exception on this one. This is a mandate that clearly has to do with good hygiene and, frankly, fairness. Senator Anwar, followed by Representative Calvaros de Gras.
Thank you so much, Mr. Chair. I wanted to thank Representative Zupkus for mentioning about the senator who actually was a proponent of a bill like this, Senator Kasser. And I think Senator Kasser was so passionate about this, and this is important to continue on the work because of the pandemic. We could not continue last time. And I want to also mention Senator Abrams, who has been very passionate about addressing this as well. And Representative Farrar, who has been truly a champion to try and get this moving forward. So we are blessed to have leaders in our legislature who actually have listened to the students, listened to the student leaders. I think to suggest that it is not leadership, I don't know how to say this in a polite manner, is if we expect the boys in our school system before they go to the toilet to first go to the nurse to get a toilet roll, and then there's equity that I can understand that. And is there a bill that says that is expected to have the usual physiologic needs for the boys being met? And the answer to that is yes, we are doing it. So why are we treating women differently? And this is something that is because of the leadership of the students and then subsequently legislators that we are actually having these conversations, which we should have had, I don't know how many years ago, but the fact is that it's about time to make some changes. It's about time to recognize physiologic needs. It's time to be able to address this. And if we have a mandate to have a toilet paper, we need a mandate for menstrual products. And that's pretty straightforward if you look at it. And if we do not believe this is necessary, then maybe somebody should put an amendment to suggest that even the toilet paper should be with the nursing staff. And anybody who's going to go to the restroom, they go to the nurses staff first, and then make sure, and we have enough nurses, because we will not be saving money. We will actually have everybody go to the nurses space in the school system to do this. So, and having to go for your physiologic needs to a nurse is not necessarily leadership. The leadership is to say, hey, we want equality. And that's how I saw leadership when I listened to the students who came and spoke about expecting the same respect, same systems as boys have enjoyed for a long time. So I just wanted to say I'm a proponent. I wanted to thank all the proponents who have been working on this in the past and current times. And I look forward to supporting the physiologic needs of our students. Thank you.
Thank you. And I'll reiterate the point you just made, that when we talk about leadership, that's in tension with the stigma still associated with having to ask. And though I'd wish that every young girl is prepared to assert their rights and to articulate their needs, it's not as easy for everybody. And not everybody's prepared to be a quote unquote leader in this context. They should not feel stigmatized, and they shouldn't have to go through the extra effort to get a basic product for their personal health. Representative Berger Travallo, followed by Representative Kennedy. Kavros DeGraw. You know, it's the hyphenated ones. I got confused once in the blue moon.
I know, it's those two names, those,
There's so many of you.
right, yes, it's the curly hair.
And then I've got John Michael Parker, but that's a different thing.
And that's
Okay.
hyphenated first.
Okay.
I guess today's personal anecdote day. I thank you so much for the time to speak. You know, I've had my period now for 34 years, and I can't wait for it to be over, if I'm being honest. And I think that the majority of the women in this room would probably agree with that. And I say that because we are called on as women, young girls, et cetera, to be leaders in so many ways. And I think that, you know, we used to call it bossy when I was little. Now we call it leadership skills when we see young women showing their leadership. And so I think that I fall in the camp of this is one area where it would just be nice to be able to access these products so simply. And honestly, as girls, as young women, you know, pretty quickly you develop a desire for a certain type of product as opposed to what you might find in a, you know, vending type situation or what the nurse might have available. But, you know, it is a universal thing that we are getting these periods, whether we choose to have children because of them someday or not. And I think that, you know, the fact that Disney literally just came out with a movie called Red Panda that is pretty much entirely about the changes a young woman undergoes at 13, including her period. If now isn't the time, I don't know when is. And I can remember so viscerally in high school, the one day I forgot a product and having to walk an unbelievably far way to the nurse's office to be able to access those products, and what a pain that was. And the fact that when you're young, your periods, as we learned on our endometriosis working group, are so irregular, and some women experience that for years and years and years, that this is just one way to make middle school a little easier. And God forbid, you know, I shouldn't say God forbid, but elementary school, you know, if you're one of the younger ones, and it's not just Black girls, but you're right, predominantly Black girls, let's just make it a little easier on these young women. And you're right, mandates are no fun. We don't like doing them. It's, you know, not great to have unfunded mandates, but they are already, if the product's already in the nurse's office, it kind of makes sense to just put them where you need them the same way we do with toilet paper. Thank you very much. I'll be voting this out of committee.
Thank you, Representative Kavros DeGraw. I agree with everything you said, except for the insinuation that we should be basing policy on what's streaming on Disney. Representative Kennedy.
Thank you, Mr. Chairman. Sorry, my button didn't work there. Thank you for the opportunity to speak on this. This is a really very important bill. It has a lot in it. I just want to raise some of the concerns that I have on this bill. Set aside the whole, number one, I don't appreciate the correlation between a menstrual product and toilet paper, but I'm just putting that out there. And secondly, yes, you did agree that this is an unfunded mandate to our schools, but a number of our schools are already moving towards this. And in accordance with this bill, this goes into effect July 1, 2022, which is this year, and most schools have already submitted to their districts their school budgets for the upcoming year. So this is going to put a hardship on. I mean, yes, it is an unfunded mandate. So I do have concerns there. I also have concerns of vandalism, of, you know, kids will be kids, boys will be boys, and stuffing these products into the toilet. And now you have lost all your product and you have plumbing issues in your schools. I'm just looking at a few things. I've talked to my schools and the schools that I represent in the districts I represent, excuse me, they've already moved towards this. And the cost is pretty significant. A couple other things I was just thinking of, and you know, to a young girl, it does get their period, and maybe they weren't expecting it that day. It can be a little frightening, daunting. And so you go to the school nurse. Well, we don't know what products the school nurse works. I don't see in here. One size doesn't fit all. So, and who's going to teach that or show that child, that student, okay, here, go, you're on your own, just figure it out. I guess I don't mean to be light of it, but I just have so many concerns because it can be personal. I mean, I remember in the day, and maybe I'm just way too old, but you know, you always had that best friend that always had something with you. Do I believe products should be in school? Absolutely. Forcing this on a July 1, 2022 is just not the way to go. I think I would like to put this bill off just a little bit and get more information on the fiscal note. And the other thing that I noticed is in this bill, it would seem that, you know, we don't allow for donations, partnership with our local health department, possibility of grants. So there are other options, but we're just putting this whole thing on our boards of education. And so this bill is very important. I do believe in a lot of it, but for today, I am going to be a no and flag it until we get more information on the fiscal note. Thank you very much, Mr. Chairman.
Thank you, Representative. Yeah, we're all in the same place. We are concerned about the fiscal note. To your point, this does not go into effect until September, not July, but the point's still taken with regard to the budget, and it's something that we will look at, presuming this bill gets out of committee today. Any other questions or comments? I don't see any. Madam Administrator, whenever you're ready, we can do a roll call vote.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong,
Long votes yes.
Representative Arnone,
Representative votes yes.
Representative Berger-Givallo,
Berger-Givallo votes yes.
Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster, Representative Django,
Representative Jenga votes yes.
Representative Green,
Representative Green votes no.
Senator Haskell,
Senator Haskell votes yes.
Representative Cavers-DeGraw,
Cavers-DeGraw votes yes.
Representative Kennedy, Representative Clarice Detrier,
Representative Clarice Detrier votes no.
Representative Linehan, Representative McCarthy, Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Parker, I did not see you on screen, please.
Huh. Can you see me now if I keep talking?
No,
No, I don't know what's going on. I got my video
I see
on.
you now.
There we go. Sorry, friends.
Thank you.
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Madam Clerk,
Representative Dauphiné, Representative Kennedy,
thank you, Madam Administrator. Kennedy votes no today.
Representative Foster, Representative McCarthy, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. Again, the votes will be held open until 6:30. Item 10 on today's agenda is House Bill 5430, an act concerning opioids. This is a JFS to the floor. Is there a motion?
So moved.
Moved by Representative Gilchrist. Do I have a second? Second by Representative Young. It should come as no surprise to the people of the state of Connecticut that we continue to have opioid legislation every year. I've been involved with such legislation all my 6 years on this committee, and it predates my experience on the committee. There's a reason for that. We haven't stemmed the tide of the opioid crisis we have as a state and as a country. The numbers are still staggering. Too many people are lost. We all know people who have experienced this directly or know someone who has. Certainly the advent of the fentanyl age, if I can call it that, has only complicated matters. The lethality of that drug, which is callously produced often in China, has had a devastating effect here in this country. So it's our job to continue to work to bring about change that will affect it. And I want to thank members of this committee, some of whom aren't even here anymore, who have put in so much good work over the years to put forward legislation that we had hoped would be enough, but it hasn't been enough. So this year, we're back again. And in the case of this year's legislation, I want to particularly thank a member of this committee, John Michael Parker, who has dedicated himself to trying to make a difference and has convened work groups with any number of people in the field who have direct experience, who run programs, all in an effort to see what is it we can do this year that's going to make a difference. This bill is still a work in process. We've added and eliminated sections over the weeks, but I think the core of it now should give us room to be encouraged that we're going to make some additional progress against this scourge. Allow me to go over a few of the sections of the bill. It adds chiropractic and spinal cord stimulation to the list of non-opioid treatment options that must be included on a patient's treatment plan. Prescribing practitioners must provide when prescribing opioids for more than 12 weeks. The point being is we should look at all viable, safe options to opioids when we can. It removes from the statutory definition of drug paraphernalia, drug testing applications used by individuals before they take drugs in order to prevent an accidental overdose. And here we're speaking specifically of fentanyl testing strips, which may be part of our defense against what fentanyl can do to people. Having the testing strips available, having the appropriate statutory definition, hopefully will make a difference there. It allows practitioners authorized to prescribe controlled substances to treat patients through dispensing controlled substances, such as methadone, through a mobile unit under certain conditions. Mobile units have been shown over and over to be particularly effective in getting to people, often at the point of an overdose, and helping connect them with appropriate services or getting them on an MAT kind of regimen where they may be on an appropriate path to dealing with their problems. It allows multi-care institutions to provide behavioral health services or substance use disorder treatment services in a mobile narcotic treatment program. Again, these mobile treatment programs have been shown to be quite effective, and requires DEMAS's triennial state substance use disorder plan to include department policies, guidelines, and practices to reduce the negative personal and public health impacts of behavior associated with alcohol and drug use. Again, this is just one more brick in the wall, if you will, in our efforts. There are a number of other things we're still talking about, which may ultimately get into this bill, but this represents an important step forward. And again, I want to commend Representative Parker for helping us get down this path. And I see he has his hand raised. Representative Parker.
Thank you, Mr. Chair. Thanks for the chance to speak just for a minute here. And it's been a real privilege to get to work on this legislation. So I just wanted to make a few
Parker,
comments.
could you up your volume a little bit, please?
Is this better? Can you hear me better now?
Much better.
Great. Thanks for asking. Just thank you for the opportunity to speak and the privilege to work on this piece of legislation. I think you captured a lot of it. I want to, like you said, acknowledge that we spoke to a lot of folks during the process of working on this bill, starting with folks living with substance use disorder, talking to folks who lost loved ones to substance use, specifically opioids, talking to providers and community health workers, folks in nonprofits, folks on the front lines, our agency partners, and certainly a number of legislators. And I think we came up with a lot of good ideas that we got to work on. And as you mentioned, some of them are ready to move forward. And so I think the pieces you articulated are really important. Just for the folks that were keeping track during the public hearing, I want to acknowledge two pieces that we took out of this bill, but to assure that they're not going away. We talked about increasing the amount of take-home dosages of methadone that could be prescribed to folks. A best practice that happened during the pandemic was getting up to 28 days, and we want to ensure we can continue that. And we feel comforted that when the federal guidelines change, Connecticut will follow suit. So even though that's not in the bill, it's still something that we'll be working on. We also talked about in the public hearing, getting an update on the voucher program for sober living homes. And that is something that we've been assured will be included in the triennial state substance use plan, which you've already mentioned here. So again, something that will be happening going forward. We also, and thanks to Eileen, our LCO attorney, for working hard on this, made sure that we changed the language from substance abuse to substance use disorder throughout this bill, which is important in the way that we use our language to destigmatize this work. And then I want to note two sections of the bill that were at public hearing that are not going forward at this point because they're not maybe quite ready. The first one has been some really good conversation around the way that we distribute naloxone in pharmacies. So we contemplated removing the training and fee and registration process for pharmacists to be able to dispense naloxone without a prescription. After having great conversations with pharmacists themselves and folks representing them and their education, we learned that while we want to increase access, the training that's provided currently is actually really important to these frontline health workers. And so what we'd like to do is take a bit more time to get a policy right that maybe decouples these ideas and ensures that we can increase access and distribution through pharmacies while also maybe bringing this training into continuing education. That's a lot to figure out, so we don't want to rush it. And that's why you don't see it in the bill right now. The other piece that we talked a lot about and heard great testimony on in public hearing was concerning data sharing among our state agencies. The idea that if we can share data more effectively, we can better articulate metrics that will guide our practices so we can make improvements on this incredibly challenging situation that Connecticut and the country and the world find ourselves in. So there's improvement to be made here, but we want to acknowledge that our agency partners are already doing a lot of work to try to share data, doing that within what we know is limited, challenging capacity because of what all of our agencies are facing, and that they are willing to be at the table as we consider some ways to better share going forward. So I want to acknowledge many of the, especially scientists and researchers and providers that told us that this could be improved, and know that we'll continue working onto that into the future. And sort of on that note, I want to acknowledge that many folks that testified on this bill and didn't testify, didn't have the privilege of getting to testify, will know that and believe that we didn't go far enough this year. Back to what you started with, Mr. Chairman, the ongoing and unremitting nature of this challenge is one that means there's so much we have to do and so many more things we'll have to do into the future. And I acknowledge that many of those advocates will feel that we didn't make enough progress here, and committed to continue working on it. And to that point, I really look forward to collaborating with our agency partners, with the many stakeholders, and especially with our colleagues in the legislature on other committees. I think the more we can work in an aligned and strategic way with the Insurance Committee, with Public Safety and Judiciary, with Education, with Children's, and ultimately with Appropriations and Finance, we can get to even more effective broad solutions that bring together the many different pieces of policy we have to be working on. So just to acknowledge the folks that say they want to see more, I know that all of us on the committee are committed to doing that, and look forward to working on that process going forward. Thank you for the time to make some comments, Mr. Chair.
Thank you, Representative, for all your good work. And I'd also like to mention the contributions of Senator Summers, who has been involved with this legislation year after year and has really engaged a lot of people in the public and has developed relationships with them to the point that they've been able to add a lot of value. You know, when we talk about public safety, I think we need to give credit to our police departments and our EMS, who have come a long ways in understanding how to deal with people who are not only having overdoses, but present substance use disorders, and how much we progressed towards directing people to MET, medically assisted treatment programs, and other less punitive approaches for dealing with their problems. That's been a great stride forward, and we want to commend those who have been understanding and have worked with us to try to find better solutions. Representative Zupkis.
Thank you, Mr. Chair, and thank you to everybody who did work on this. This is so important, and it hits close to home. I know I've had some close friends that unfortunately have gone through this. So I really appreciate the work that has happened here. Just one question in talking with my colleagues, because I definitely support this bill and think that there's a lot of good things in here. There was a bill passed, I believe, last session about minors can go and get mental health visits without parental consent. And so my hope is that that doesn't participate in this bill. So these mobile units or different places that prescribe controlled substances, would a minor have to have parental consent to get these drugs?
Thank you, Representative, for the question. My understanding is that we're not changing the rules as it applies to minors in this bill. And I'm not sure why a mobile means of engaging them would be problematic from that point of view. In any case, I'm not sure I have a good answer for you. We can look further into the existing statutory language, but as I said, this bill does not anticipate changing the statutes with regard to minors just because we might encounter them through the use of mobile units.
Okay, so when you say don't change it, then they would still have to get a parental consent if it was for a minor, if they're giving out drugs? Is that just to be clear as to what you're saying, Mr. Chair?
Whatever existing statutory law is would not be changed.
Okay, so I'm going to support this because it is so important, but maybe Representative Parker, we can talk further, because if parental consent is not applied to this, then I have a problem with it. But I thank you for your good work. Thank you.
Thank you, Representative.
Absolutely.
I don't see any further questions or comments. Uh,
Mr. Chair, if there is
McCarty.
no objection, can we add this to the consent calendar?
First of all, Representative McCarty, who is a recent arrival, is in the process of getting all her technology together, and I believe has a question or comment.
Thank you very much, Mr. Chair, and I do apologize. Education just finished a few minutes ago, so
Oh, those
I was
slackers,
right
they-
across from you here. But I did want to add, and I know you've been absolutely superb at when we have proposals, and if going forward, we see if there's anywhere that we can maybe add to it. So I hope some more discussion, perhaps going forward. I'm concerned that there wasn't too much in the bill looking at when we have opiates in the home, how we can dispose of them right at the home, that we would not have to go to the police department or to the boxes. So I did have some language there, and I hope you'll allow me to have further discussions with you on that.
Well, thank you, Representative. Certainly, we will always welcome additional conversation. It is something we discussed, and there were some challenges related to such disposal. Representative Parker, do you want to comment at all on where we stand with that subject?
Sure. Most importantly, Representative McCarty, I'm happy to continue working on this with you going forward out of committee. In terms of my understanding of disposal, when we discussed that with the agencies and with some providers, we understood that there are ways to dispose simply and safely at home using things that are already found in the house, including coffee grounds was the first one that comes to mind, and I can't remember the other. We were told it's important not to flush opioids in the toilet, to get them into the water stream. So there is a little bit of education on that. I actually was able to attend on just Monday of this week a training through the community for use of naloxone, and they discussed this point in it. So I know the education is trying to get out there, and there's potential for maybe some policy around when opioids are dispensed through prescriptions. If I know we looked at if there would be a disposal system with that. And so there might be a way to think about including that education of other ways to ensure for safe disposal. So all to say, happy to continue that conversation and try to get a policy that takes into account what could be done in the home already without adding something else to it. But we'll give you a call later today to discuss it. I hope that's helpful.
Thank you, Representative. And I believe the other material that's often used is kitty litter, though I strongly recommend fresh kitty litter.
If I,
Okay. Representative McCarty.
you always make me laugh, Chairman. Thank you. Just that what I was discussing with the disposal would not have any environmental negative impact. So I would appreciate if going forward we could continue the discussion. Thank you.
Absolutely, Representative. Are there any other questions or comments? I believe then we are ready for a vote. We will proceed via roll call. Madam Administrator.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong,
Senator Huang votes yes.
Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster, Representative Jenga,
Representative Jango votes yes.
Representative Green,
Representative Green votes yes.
Senator Haskell,
Senator Haskell votes yes.
Representative Kavros DeGraw,
Evers DeGraw votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Clarice Deacher,
Representative Claire Destituria votes yes.
Representative Linehan, Representative McCarty,
Representative McCarty votes yes.
Senator Moore, Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Representative Dauphiné, Representative Foster, Representative Linehan, Senator Moore, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. Again, we will hold the votes open until 6:30. We now move to item 11 on today's agenda, House Bill 5479, an act concerning indoor air quality in schools. This is a JF. Do I have a motion? Moved by Representative Gilchrist. Do I have a second?
Seconded.
Second by Representative Berger. I almost did it. Kavros DeGraw. I don't need a nameplate. I need a mental health break. But let's continue on. There's no rest for the weary. Okay. There are many things we learned from the pandemic the hard way. If you recall the early days of the pandemic, we had a particular problem in our nursing homes, and that brought to the fore a greater appreciation and concern about how we provide air quality in densely populated facilities. And I was a member of a working group that looked at capital investments that would have an impact on how nursing homes protect their residents. And we've put a lot of focus on HVAC systems, heat and ventilation and air conditioning, pretty basic stuff. And we discovered, perhaps not to our surprise, given the age of many of our nursing homes, they had systems that were not up to the task and maybe reflected old paradigm technologies. And we sought to find additional funding for nursing homes that would make a difference. We really didn't, which is disappointing, and maybe we yet will. But the education I got as part of that initiative applies even more so, I believe, to many of our school facilities across the state, many of which are of similar vintage to some of our nursing homes. But even some of more recent vintage have experienced serious problems with water incursions, mold, other types of contaminants that relate oftentimes to inadequate HVAC systems. And then we had the pandemic, and we recognized that school children and staff who had perhaps experienced problems before the pandemic were even more at risk with the pathogens that were now in the air. And we had great difficulty figuring a way with that densely populated student body to take care of it. Thankfully, the governor has committed in this budget to put significant funds against the prospect of redressing the problem in many of our schools. And this bill is intended to help structure and guide the allocation of such spending such that we can help as many schools as possible. There's also a bill, an excellent bill that's come out of the Labor Committee that also makes headway on this, and it's our intention, particularly working with Senator Kushner, who's Senate Chair of Labor Committee, to see a way for our two bills to match up and cover the entire gamut of things that need to be considered in this context. It's more complex than people think because it's not simply a matter of appropriate temperature and water tightness and a good boiler and appropriate venting and good filters. It's really all these things and then some. There's a lot of new technology out there that apply not simply to filtering. Really, the three pillars of good air quality in schools are ventilation, filtration, and circulation. We need to address all three of those things effectively. There's a lot of talk about what are the most appropriate filters, particularly when we're retrofitting older systems. And most importantly, the role of controls that both manage and monitor the system and their ability to adjust across perhaps a very large facility to maintain uniform conditions across the system. So our hope is to create legislation that will provide a map to most likely the Department, to DAS and perhaps the Department of Education to figure out how best to allocate these funds. If we do our job correctly, we won't be talking about replacing out every school's boiler and entire system at the cost of many millions, but we'll consider customized solutions for each school that will allow us to perhaps retrofit, complement or supplement with new technologies, and make sure that the control systems and those who operate them are up to speed. And that's really the other aspect of this, which is it's not about the fix necessarily, and we'll need a lot of money to do that. It's about the ongoing monitoring and control of these systems. I was surprised to learn in my research that many schools don't necessarily have a dedicated monitoring program or people to make sure that they're aware of problems before they become really bad. My community, a wealthy community, Westport, had such a program. And even then, we had a school which had water incursion, serious mold. We had to strip it down to the studs and virtually rebuild it at a cost of tens of millions of dollars. It can happen in any school system across this state, wealthy or poor, new building or old. And we have a lot of work to do on this score. This is again an opportunity because we have ARPA funds. We may even be able to apply some infrastructure funds if that comes down the pike. But we must do something now if we're going to protect the health and safety of our students and staff. So let me just talk to you briefly about what we have in this bill. It makes various changes affecting indoor air quality in school facilities. It requires school boards to ensure that their HVAC systems are maintained and operated in accordance with standard 62, which I'm sure we're all familiar with, standard 62, right? Current law requires HVAC systems to comply with the prevailing standard when the system is installed or renovated. It also requires school boards to close the school for the day if that standard 62 cannot be maintained for 2 or more consecutive school activity hours, any time of day in which students are in the building or school personnel occupy a school facility throughout the year. Under the bill, the school boards must maintain each of their gymnasiums in an indoor temperature between 65 and 85 degrees Fahrenheit while students are using the school, or close it for the day if the school cannot meet the temperature requirements for more than 2 consecutive hours. And I will add, if I had my druthers, we'd be talking about more than just gymnasium temperatures. And maybe it's something we need to look at more. Additionally, the bill requires DPH to establish a routine indoor air quality monitoring program by June of 2023 for school boards to review and approve this program triennially starting by 2026 and establish related reporting requirements by June of 2024. It requires school boards to implement the DPH program in their schools by June of 2024 and allows school boards, under certain circumstances, to transfer the program's execution to their regional council of government. It requires DPH to establish a voluntary contractor certification program for school indoor air quality services and for school boards to contract only with DPH certified contractors for these services starting in June of 2024. It requires school superintendents by December of this year to designate an individual within each school board to be responsible for receiving complaints about poor air quality at school facilities and report the complaints to the superintendent. And lastly, school boards must participate in the federal EPA's air quality flag program by June of 2023. This may not represent everything we're going to do. We're still having conversations. We're scheduling a meeting for next week with some real experts to try to get further clarification on some of the things that we can do. But we are eager to get this bill passed so that we can take advantage of existing funds, have the governor honor his commitment to spending money against this, and see how many schools we can fix up. Because I hate to tell you, we may have another pathogen coming down the pike someday. And that pathogen may actually be harder on kids than this most recent coronavirus was. And we want to be ready. We want to have adequate systems in place to take care of our students and staff so that we don't have what is more than episodic episodes of illness presented in our schools that are related to pathogens. Representative Carpino.
Thank you, Mr. Chairman. Just very briefly, I'm glad you mentioned the word safety. I'm supporting this bill today, but I just want to make sure that we keep in mind the disruption of an emergency school closure on parents and the safety of kids. That is always my concern. Single parents, not every parent, particularly in my district, has the luxury of working from home. So before we're closing a school and sending a child home to a potentially unsafe environment, I think we need to look a little closer at that, what other options schools have before sending kids home. Again, I too worry about the safety of our students, particularly our young students, our kids who are used to coming home in a certain period of time, and parents who are always struggling to make sure that their kids have a safe place to go after school, and being faced with a sudden school closing might put our kids in even more harm. So I'm supporting this bill today, but I do think we really need to look at that provision as it moves forward. Thank you, sir.
Thank you, Representative. That's an excellent point. And certainly that should always be a last resort when we can't guarantee a safe school environment. But the best answer is it should never have to happen because we've remediated our schools.
If I may, Mr. Chairman, I appreciate that, but things happen, systems break, and unscheduled, at least with, in the homes I've owned, you can't always count on everything working when it should. And I just want to make sure that we have contingencies in place. So I'm happy to help in any way I can as this bill moves forward.
Well, thank you, Representative. We will take you up on that. Safety first, but there may be ways to accomplish that short of the extreme example. Representative Pettit, good to see you.
Thank you, Mr. Chairman. I think most of us are conceptually in favor of this, and as always, the devil's in the details. I would note that the Commissioner of Public Health, when she testified, noted that the bill duplicated activities and procedures currently existing and required by SDE and Department of Labor. Are those things that you think we need to take care of on the floor? Are they not significant enough to create an issue for the bill at this time?
I think it's premature to give you a definitive answer on that, Representative. It's our intention to review the bill that came out of Labor, see what we can do to make it all hang together. But to your point, a critical part of all this is the Department of Public Health. They have to be prepared with their limited staff to take on whatever we put on their shoulders. And so I think it's a valid point to make sure that we cover off on them, whatever the final legislation looks like.
Thank you. And thinking about some admonishments from the speaker recently, I may be calling for conjecture or hypothesizing on your part. Do you envision this is a big lift, an expensive lift? Do you envision that this going forward would be made part of bonding and school construction and rehabilitate type projects so as to take a lot of the pressure off of the localities in terms of funding this, just in general terms?
My understanding, Representative, it's the governor's budget that will drive most of the funding choices here. I think that there'll be some of that negotiation. And your guess is as good as mine as how legislation will or will not reach the floor under these shortest of short session days. I'm heartened by the fact that the governor has made this a priority and that this seems to be something that everybody agrees is an appropriate use of available funds and could make a real difference in the lives of our children. So I am hopeful that this will rise to the top and get a vote on the floor with significant and appropriate funding.
Thank you. My minimal vote counting suggests that this probably will get out of committee. I'm going to be a no today because of a number of concerns about the details, and hope that those can be worked out so that I can be a yes when it comes to fruition on the floor. Thank you, Mr. Chair.
Thank you, Representative. Seeing no comments or questions further, let's proceed to a roll call vote. I'm sorry, Madam Administrator, Representative McCarty, a little late on the trigger
No,
there.
you know what? It was up and then the hand went down again. I don't know why.
So you
but-
say, Representative.
Thank you very much. Yeah, thank you. I just wanted to thank you for your explanation. Naturally, indoor air quality is so important to all of our schools, and it's been brought to the full attention of the legislature. We're pleased to see the 90 million. But to Representative Pettit's remarks, I think there is ongoing discussion on including HVAC in the construction grants, school grants, so that we can try to avoid this problem going out into the future. Right now, we have the immediate problem. I will be supportive of the bill today, but again, like I said, with the opiate, I hope we can have some discussion with those district leaders to how, because I don't want to see either the children if they have the temperature in the gyms. That's the one piece that I'd like to talk about a little more. We don't want anyone to be put at any kind of health risk, but we also have to find a solution to that piece of the bill. So I will be supportive today, but with that proviso in there.
Thank you, Representative. I'm glad you got your hand raised in time
Thank
to
you.
share. And we will definitely be working on this in the near term. Though I will say that it's often the gymnasiums where we see the really bad events occurring, because the combination of temperature and humidity can really, and strenuous exercise can be a bad combination for some of our students.
I appreciate that, but finding a solution, we might be able to move the students to a different area, but just to have that ongoing conversation so that we want to do the air quality, but we want to be in harmony with those districts so that we can find the right solution. Thank you.
Thank you, Representative. Seeing no further comments, once again, Madam Administrator, I believe we're ready for a roll call.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner, Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong.
Senator Huang votes yes.
I did not see you on screen, please. Senator Wong.
Can you see me?
Yes, I see you now. Thank you. Senator Summers, Representative Pettit,
Representative Pettit votes no.
Representative Arnone, Representative Berger Givallo,
Givallo votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes no.
Representative D'Amico,
Madam Administrator, sorry about that. Representative D'Amico votes yes.
thank you. Representative Elliott,
Representative Elliott votes yes.
Representative Foster,
Rep. Foster votes yes.
Representative Django,
Representative Django votes yes.
Representative Green,
Representative Green votes no.
Senator Haskell,
Senator Haskell votes yes.
Representative Cavus DeGraw,
Cavros DeGraw votes yes.
Representative Kennedy,
Kennedy is a no today.
Representative Clarice Detrier,
Representative Clarice Detrier votes no.
Representative Lenahan, Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes. Senator Moore votes yes.
thank you. Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Terciak,
Representative Terciak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Senator Kushner, Representative Arnone, Representative Linehan, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. We'll stay open till 6:30, which is fast approaching. Next up is item 12 on the agenda, House Bill 5481, an act concerning the Department of Public Health's recommendations regarding change of ownership in healthcare facilities. This is a JFS. To the floor. Is there a
So
motion?
move.
Second.
Second.
Done by Senator Anwar. He got in that. And seconded by?
I'll take it, Terciak.
All right. Terciak rises to the occasion. All right. I think everybody in this committee is aware of some of the changes to the ownership of various healthcare practices here in the state of Connecticut. And I wish I could say that all such changes have been to the benefit of the quality and access of patients in the state of Connecticut, but I can't. That there have been some changes that have led to the demise of a lot of smaller practices. And I acknowledge some of those changes relate to managed care and the cost of running a practice or paying for malpractice insurance. There are a lot of stressors on the practice of medicine today. There's also factors such as the rise of acquisitions by equity firms whose objectives may be profit over quality, which can be of concern to us. This bill, I understand, is intended to address one of the gaps that we currently have, which relate to changes of ownership. It requires all ownership changes for DPH licensed healthcare institutions to be subject to DPH review and approval. Current law exempts certain ownership transfers from this process, including those involving transfers of less than 10% of a corporation's stock. The bill establishes an application process for these proposed transfers, requiring the proposed new owner to apply at least 120 days before the transfer. It specifies several matters that must be included in the application, including information on other facilities the applicant may own or operate or have operated within the past 5 years. It also prescribes certain steps in DPH's review process and allows the commissioner to assess a civil penalty of up to $1,000 per day for violations of the law or regulations. That's strong, but it's intended to deal with potential bad actors who seek to end run the system by looking for the loopholes in it. And we believe may be an effective means by which to address what we see to be perhaps an emerging problem. Are there questions or comments? Representative Pettit.
Thank you, Mr. Chairman. I think like with many of the bills, the intent is good. I still have some concerns, but I think we received testimony from Leading Age and perhaps some other people that they're looking for further changes, nuanced changes in the language. And after having conferred with them with the JFS language, they don't feel that the JFS language we currently have gets to all the points that they were concerned about. So I'm going to be a no today, and if it gets through committee, hopefully we can then make changes on the floor that address the concerns of the folks that are at the front lines taking care of patients in many of these facilities. Thank you, Mr. Chair.
Thank you, Representative. Yes, we have had conversations and we'll continue to have conversations with them. It's a challenge sometimes given the different roles and organizational structures of some of the healthcare organizations within the state to come up with a one-size-fits-all that has the appropriate application. And it's conceivable we have more work to do on this, and we remain open to getting that language right.
Yeah, I mean, they don't want the changes to be deterrent to new business, to changes where you actually may bring in someone who may improve the facility. So I think it behooves us to make sure that we sit down with DPH and some of the people involved in the field to make some, I think there are small changes, but make the changes that would make it best for all concerned. Thank you, Mr. Chair.
Thank you, Representative. Thanks for bringing up the point about investment. You know, we were just talking about HVAC systems and problems in nursing homes as well as schools. A lot of our facilities are really old, and if we can encourage investments that both improve the quality of life and the health and safety of the residents, that's in our interest. So that we certainly don't want to create obstacles to that. Seeing no further comments, Representative Kennedy.
Thank you, Mr. Chair. I appreciate that. Mr. Chair, I just wanted to comment that a no vote doesn't necessarily mean that I'm opposed to something, but as written currently and needing more information. So I say that with respect to this bill, that I'd like to wait for a little bit more information. You said it does address some of the gaps, but in looking at the testimony, they are looking for some adjustments, as the good ranking member stated. So I will hope that that will come true and look forward to seeing this in a different language.
We know where you're going, Representative. I will just say that I too struggle with language sometimes, like right now. But the more important point is that I appreciate the fact there are many different nuances to a no vote, just as there sometimes are nuances to a yes vote. And that's why we in committee give ourselves opportunities to clarify, amplify, dimensionalize why we're voting one way or another. And I just wish our constituents would be appreciative of the struggles we have sometimes when we're trying to decide what to do and all they see is either the green or the red. And it's usually more complicated from my experience.
I appreciate that, Mr. Chairman. Thank you very much. It's been a long day.
There you go. Now we found the words. Okay. Use your words. Okay. I do believe we're now ready for a roll call vote.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Representative Pettit,
Representative Pettit votes no.
Representative Arnone, Representative Burger Givallo,
Burger Givallo votes yes.
Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes no.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Representative Elliott votes yes.
Representative Foster,
Rep Foster votes yes.
Representative Django,
Representative Django votes yes.
Representative Green,
Senator Green votes no.
Senator Haskell,
Senator Haskell votes yes.
Representative Cavers DeGraw,
Cavros DeGraw votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Clarice Detrier,
Representative Clarice Detrier votes no.
Representative Linehan, Representative McCarthy,
Representative McCarty votes no.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Senator Wong, Representative Arnone, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. We are keeping the votes open till 6:30, whether you like it or not. Now, item 13 on the agenda, our last item, but I remind everybody to hang around for the exciting outcome of our consent calendar vote. Item 13 is 5485, an act concerning various revisions to the public health statutes. This is a JF to the floor. Is there a motion?
So moved.
Moved by Representative Gilchrist. Do we have a second? Seconded by Representative Young. I believe this title says it all. Various revisions, and I mean various, they're all over the place. Though I will, to assuage any concern by our LCO, it does not include changing all references to inmates to incarcerated. Not this year, but get ready for next year. It has a number of elements in it, and they are not related, therefore various. I'm not going to enumerate other than to say that there are a number of other things that may eventually end up in our various revisions as they do every year. Very exciting, sort of surprise entries that you'll have to keep your eye open for, like an implementer. It may actually end up holding several other bills as we seek to amalgamate, as is our predilection as the days dwindle. But I don't have anything to add currently. Comments or questions? Representative Carpino raises her hand physically.
It has been a long week. Thank you, sir. Any chance you are at liberty to give us a sneak peek as to what might end up here in a future version? We have waited patiently all week. Please, sir.
Since you insist, Representative. Here are just a few of the coming attractions. It removes, as members of the state's Chronic Kidney Advisory Committee, the Public Health Committee's chairpersons and ranking members, and 4 members they appoint. Dare I go on?
Thank you, sir. I was hoping you were going to mention the coming attractions that are not yet here with us.
There are things that have to deal with I'm not prepared to answer that, other than to say that I am aware of some things that have been suggested to the committee, and I am glad to follow up with you, but that would spoil the surprise.
Fair enough, and thank you. I'm sorry to have confused you. I read the bill before us. I was looking for the coming attractions. Thank you, sir.
I reserve the prerogative to change my mind. Any other comments or questions? Madam Administrator, just to move it forward, let's just go ahead and have a roll call vote. Everybody get to vote.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Representative Pettit,
Representative Pettit votes yes.
Representative Arnone, Representative Burgess-Givallo,
Rep. Burger-Givallo votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Representative Elliott votes yes.
Representative Foster,
Rep. Foster votes yes.
Representative Django, Representative Green,
Representative Django votes yes.
thank you, Representative Green. Representative Django,
Representative Django votes yes. Thank you.
you're welcome. Senator Haskell,
I vote that Cheryl.
Senator Haskell votes
let me get
yes.
this one last point.
Representative Cavus DeGraw,
Gavros DeGraw votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Clara Desditria,
Representative Claire Desditria votes yes.
Representative Linehan, Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon,
Representative Scanlon votes yes.
Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Young, can you do that for me again, please?
Representative Young votes yes.
Thank you. Representative Zupkis,
Representative Zupkis votes yes.
Senator Wong, Representative Arnone, Representative Dauphiné, Representative Linehan. Thank you, Mr. Chair.
Thank you, Madam Administrator. I'll give you a second to breathe because I believe our next item of business is to have that exciting vote on the consent calendar. If you could at first confirm that we have anything on the consent calendar, I think we do.
We have two bills on consent, sir.
Beg your pardon?
We have two bills on consent.
Would you be willing to tell us which ones?
Item number 1, Senate Bill 254, and item number 3, Senate Bill 369.
Thank you, Madam Administrator. That conforms with my understanding. I believe we're ready for a roll call vote.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner.
Senator Kushner votes yes.
I did not see you on screen, please, Senator.
Senator Kushner votes yes.
Thank you. Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Representative Pettit,
Oh my God, I can't believe it.
Representative Pettit votes yes.
It's too funny.
Representative Arnone,
Freaking video to upload.
You're unmuted, Michelle.
Are you on board with it or are you trying to talk?
Representative Berger Givallo,
Rep. Berger Givallo is a yes.
Representative Carpino,
Representative Carpino is a yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Representative Elliott votes yes.
Representative Foster,
Rep. Foster votes yes.
Representative Django,
Representative Jenga votes yes.
Representative Green,
Representative Green votes yes.
Senator Haskell,
Yes.
Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kennedy,
Kennedy votes yes. Did you see me?
No.
Kennedy votes yes.
I cannot see you, please.
Kennedy? Hold on. Kennedy votes yes.
Thank you.
Thank you, Madam Administrator.
Representative Clarice Detrier,
Representative Clarice Detrier votes yes.
Automatic attack.
Representative, can you hold a moment, please?
I'm sorry. Again?
No, not you. Thank you. Representative Linehan, Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon,
Representative Scanlon votes yes.
Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Wong, Representative Arnone, Representative Dauphiné, Senator Haskell. Thank you, Mr. Chair.
Thank you, Madam Administrator, for all your good work today and for all the staff. Before we move on, Representative Foster, please, wait a minute. Before we recess until 6:30, I just want to remind members of the committee and members of the public that on Monday, the 28th, we will be having a special informational forum with the CVH Whiting Task Force, which will begin at 9 a.m. and run till 10:30 a.m. via Zoom, where we will hear directly from the members of that group and their recommendations prior to having a public hearing, which will commence at 11 a.m. via Zoom, which will include the bill, which seeks to act on those recommendations. And also to remind members of the committee, we will be meeting one last time, maybe, if we behave ourselves, on March 30th at 9 a.m. to JF out any other bills that we so choose. If there are no other questions or comments, we stand recessed. Yeah, really, I thought it could be a lot worse. Yep.
Representative Scanlon, are you there?
Yeah.
Bev, can I vote?
Just a moment, I have to check to see what you missed. You missed item number 4, Senate Bill 448.
Representative Foster votes yes. Four nine as well.
Yes, you missed 449. How do you vote?
Representative Foster votes yes.
You missed 453. How do you vote?
Representative Foster votes yes.
You missed item number 9, House Bill 5272. How do you vote?
Rep Foster votes yes.
You missed item number 10, House Bill 5430.
Rep Foster votes yes.
And that's it for you. Thank you.
Thank you so much, Bev. Have a great day and a good weekend.
Same to you.
Beverly,
Rep Elliott.
I'm here and ready.
Okay. You missed item number 7, House Bill 5001. How do you vote?
I vote yes.
Item number 8, House Bill 5261.
I vote yes.
Item number 9, House Bill 5272. How do you vote?
I vote yes.
Item number 10, House Bill 5430. How do you vote?
I vote yes.
That's it for you, sir.
All right. Thank you, Beverly. Have a good weekend.
Yep. Kevin Ryan?
Yeah, I was on another meeting. Did I miss one vote near the end?
I think so. Just a moment.
okay.
I'm thinking it was number 10.
An act concerning opioids. Let me just double check the other one. Yep.
I vote yes.
I need to see you on screen, Representative Ryan. please.
You can't have everything. Okay, there I am.
Thank you.
Is that the only one? Did I miss like 11 and 9?
No, 9, you're okay. 11,
I think I did get 11.
you're okay.
Okay, that's it then. Thank you.
You're welcome. Have a good weekend.
Same with you.
Senator Kushner, you're next in line.
Thank you.
You missed item number 2.
Senator Kushner votes yes.
Item number 4.
Senator Kushner votes yes.
Item number 5.
Senator Kushner votes yes.
Item number 6.
Senator Kushner votes yes.
Sorry, where's the rice?
Item number 7.
Rice?
Yes,
Senator Kushner
back.
votes yes.
Freeze, the chicken flavored rice.
Just thank you, Senator. Just a moment. Let me keep
I
going.
think I missed another one. Oh, I know. I think I missed number 11.
Yes, you did.
Senator Kushner votes yes.
That's it for you, Senator.
Thank you, Beverly, and have a wonderful weekend.
Same to you.
Hello, Beverly. Is there a waiting line?
Yes, please.
Okay, thank you.
You're welcome. Representative McCarthy, I'll be with you shortly. Representative McCarthy?
Guys, I'll go here and change.
Thank you very much, Beverly.
Beverly.
Thank you very much. I'm ready.
I have you on consent, so item number 2 on the agenda. Representative McCarthy.
Yep, Representative McCarty votes yes.
Item number 4 on the agenda.
Representative McCarty votes yes. Just lost you. I'll be right
Item
back.
number 5 on the agenda.
Item number 5, McCarty votes yes.
Item number 6 on the agenda.
McCarty votes yes.
Item number 7 on the agenda.
McCarty votes yes.
Item number 8 on the agenda.
McCarty votes no.
Item number 9 on the agenda.
McCarty votes no.
I have your mark for everything else. Thank you.
Thank you so much, Beverly.
Representative Green.
Hi, Beverly. I think I missed number 448.
Yes, you did. How would you like to vote, please?
I'd like to vote yes, please.
Let me just make sure you're on everything else. You're all set. Thank you.
Thank you. Have a nice weekend.
Yes, Representative Jenga. Representative Jenga, are you ready? You're on mute.
Okay,
I can hear you now.
sorry
You missed
about that.
Item number 7, how would you like to vote?
Number 7, yes.
That's it for you, Representative. You're all set.
Wow, thank you very much. Sorry about that.
That's okay. Did I get you on? Yes, you're on consent. You're good. Representative Cook,
Hi, honey.
did you miss something?
I don't know because I was
Okay.
bouncing back and forth, so I just wanted to make sure.
Okay, I'll check, no problem.
I think it would be more towards the top versus the bottom, but I'm just not 100% and I don't want to make a mistake.
That's okay.
I would have come downstairs to see you, but you're not here.
You couldn't vote like that. You have to vote via Zoom.
I know. I would have brought my computer with me.
I have you voting on everything.
Perfect. That's all I need. Thank you, my friend. I will see you next week.
Senator Haskell, you're next in line.
Thank you so much, Beverly. I think I just missed one, which was the issue of reproductive health access, but I could be wrong. There may have been others.
Yes, you missed item number 8. How would you like to vote?
Senator Haskell votes yay.
Let me just double check everything else for you, please.
I so appreciate that.
Thank you. You're all set.
Have a great weekend.
Same to you. Senator Haskell, don't go, please.
I'm back.
You missed consent.
Oh, I thought I voted on consent. Okay, Senator Haskell votes
I
yay.
don't have you as marked. How would you
No
like
problem.
to vote?
Yay.
Thank you.
Thank you so much.
Senator Wong, are you there? I can't hear you.
I am, madam.
Thank you. Let's see what you missed. You missed item number 12. House Bill
If I may,
5481.
what was my vote on item number 11?
Yay.
Okay, thank you. And so on number 12, can I ask what Dr. Pettit and
Dr. Pettit voted no. Carpino voted no. Dauphiné voted no. Green voted no.
no, I just wanted to double check that. Thank you, madam. I will be a no.
Thank you. You also missed number 13.
That would be a yes.
And I missed you on consent.
A yay.
Thank you. Have a great
Thank you,
weekend.
madam. And you have a great weekend. Thank you for your great work.
Thanks. Representative Kennedy.
Thank you, Madam Administrator. Can I change my vote on number 8?
Can you change your vote on number 8? Just a moment. So you would like to change your vote to a yay?
Correct. Yeah.
Thank you.
Thank you, Beverly. Have a wonderful weekend.
Let's make sure you didn't miss anything else, please.
I don't think I did.
I think you're all set.
You have a wonderful weekend. Thank you so much.
You're welcome.
Bye.
Bye. Representative Dauphiné, you're still here with me? How would you like to vote on consent?
Yes.
Thank you. You missed item number 2. How would you like to vote? No, you voted on 2, sorry. You missed item number 4.
I'm a no.
Number 5.
Were there any no's on that?
Number
Beverly?
4.
Number 5.
Number 5. No.
Okay, I'm a yes. Representative Dauphiné votes yes.
Thank you. Number 6 on the agenda.
Representative Dauphiné votes yes.
Number 7 on the agenda.
Representative Dauphiné votes no.
Number 8 on the agenda.
Representative Dauphiné votes no.
Number 9 on the agenda.
Representative Dauphiné votes no.
Number 10 on the agenda.
Rep. Dauphiné votes no.
Number 11 on the agenda. I got you on 11, sorry. And I got you on 12.
But I think not on 13. I think I
13,
lost.
you missed 13.
Yeah. Was there any no's on that one?
Nope.
Okay, I'm a yes.
Thank you.
Thank
You're
you.
all set.
Thank you, Beverly. You have a great weekend.
Same to you. Thank you. Representative Petty,
Thank you, Madam Clerk.
how are you?
Tired,
I know.
psychologically speaking.
Okay, we start with item number 2, Senate Bill 329.
I'm a no.
Item number 4, Senate Bill 448.
I am a yes.
Item number 5, Senate Bill 449.
Senator, yes on 5. 449.
Item number 6, Senate Bill 453.
That is a yes on 453.
House Bill 5001, item number 7.
That is a yes on 5001.
Item number 8, House Bill 5261.
Pettit is a no on 5261. I have concerns that we needed to put some guidelines in terms of training, even though DPH and the Attorney General say that it's within scope. So hopefully that will, since I think it's going to pass, hopefully that will be done on a local or regulatory basis.
Item number 9, House Bill 5272. Menstrual products.
Yeah, I'm yes in theory, but no on 5272. Superintendent and chair of my Board of Education that want to have their own plan and not be mandated by the state.
I think I have you in everything else.
Yeah, I think that's the rest. Long day, another long day Monday.
Monday? I only have 74 or 75 people right now, which is a lot because the Q&A is where the problem comes in.
Exactly. Exactly.
Okay,
Well, I hope-
is Representative Betts going to log on before
I
6:30?
don't believe, he said no yesterday. Then this morning he sent a text and said maybe he could get here, but haven't heard. I will text him and give you his answer, but I'm thinking it's no. So if he's the last one, I'll let you know if he gets back to me.
Okay, we are open until 6:30, so
Either way?
either
Okay.
way, he's good
Okay.
until 6:30.
Okay,
He's just
thank
got
you
a
so
problem.
much.
You're
You have a
welcome.
beautiful weekend. Thank you.
Same to you. Bye-bye.
Bye-bye.
Hi, Beverly.
Hi, Representative Lenahan, how are you?
I'm well. I can't thank you enough for everything that you've done for me today.
No
I really
problem.
can't. I just want you to know from the bottom of my heart, like, I know you're probably thinking, why does this mean so much to you? But I'll just give you a little hint. I know we're being recorded, but I'll show you. For her. So thank you.
Okay.
So what do I need to vote on, Madam
You
Administrator?
need to vote on the consent calendar.
Okay.
Two bills went
Representative
on-
Linehan votes yes on the consent calendar.
Okay.
And is that it?
Nope.
Oh.
You missed a couple votes.
Oh, my apologies.
In the end, no problem, no problem at all. I'll find where we were. Okay. Okay, you started missing votes at item number 9, House Bill 5272.
Representative Linehan votes yes.
Item number 10, House Bill 5430.
Representative Linehan votes yes.
House Bill 5479, item number 11.
Can you refresh my memory as to what that one was?
In an act concerning indoor air quality in schools.
Yes, Representative Linehan votes yes.
Item number 12, House Bill 5481, the transfer of ownership in healthcare facilities.
Representative Linehan votes yes.
And the last one is item number 13, an act concerning various revisions to public health statutes.
I always want to say no because it's funny, but it's not. So Representative Linehan votes yes.
Thank you, and you have a great weekend.
Thank you. You as well, Madam Administrator. And again, I appreciate you so much.
Thank you.
Bye.
Bye. Hi, Sean.
Hi, Bev.
Okay. You missed item number 2, Senate Bill 329.
We got a lot of bills this year. There's been a lot of meetings, right?
Talk to Jonathan.
I'm
I
gonna,
have
man.
sleepless nights and nightmares.
This is, I mean, like I'm so busy and I feel bad that I haven't really been able to participate in public health this year, but it's just like, whew,
I know.
a lot of meetings. Okay, so I got the agenda up. Which do you need me for?
Item number 2, Senate
Um,
Bill 329.
is it true that I'm the deciding vote on that or no?
No.
Okay. Are there any Democrats who have voted no, or it's party line?
I'm looking at it right now. Michelle Cook voted no.
Okay.
Nika
All right.
voted no.
I'll vote yes, please.
Thank you. Item number 4.
Yes.
Item number 5.
Yes.
Item number 6.
Yes.
Item number 7.
Yes.
Item number 8.
This is the physician's assistant's abortion bill.
Yep.
What's that one looking like?
Oh, just a few no's.
Okay, I'll vote yes.
Item number 9, House Bill 5272.
Yes.
Item number 10.
Yes.
Item number 11.
Yes.
Item number 12.
Yes.
And I did get you on 13 on the consent, so you're good.
Okay, thanks.
Thank you.
Have a good night. Have a good weekend.
Same to you. Bye-bye.
Bye.